Good morning to you.
Good morning, ma'am. So nice to see you here. I think we can begin this session. Devangana, you can take over.
Thank you, ma'am. Good morning, Imrana, ma'am. Good morning, everyone.
Good morning.
With the permission of all the speakers, I am starting the program for today. I hope I'm audible to all the participants. Good morning to all our eminent guests, erudite speakers, respected principal, members of teaching and non-teaching staff, valued participants, and dear students. On behalf of the entire organizing committee, I, Devangana Jha, from the Department of Economics, warmly welcome you all to the second day of the second annual international conference, Equinox-2022, organized by the Center for Research under the aegis of Vantage, Journal of Thematic Analysis, and the IQAC of Maitrey College. After the successful completion of the first day yesterday, we are all looking forward to yet another day of intellectual stimulation, meaningful engagement, and constructive dialogue. And we are delighted to have with us today, as our first speaker, Professor Imrana Qadir. The title of her talk today is Revisiting Perspectives in Public Health for People's Health and Well-being. Professor Imrana Qadir is a well-known public health expert. Before joining the Center for Social Development, she was a professor at the Jawaharlal Nehru University, where she taught for 35 years and then served as the J.P. Nayak Senior Fellow at the Center for Women's Development Studies. Ma'am's area of interest includes organizational issues in health services in South Asia, with a special focus on India, social epidemiology and the political economy of health, women's health and research methodology, with an emphasis on interdisciplinary research methodologies. Professor Qadir has also worked with the Ministry of Health and Family Welfare, the Planning Commission, the Population Commission of India, and the advisory and monitoring bodies for the National Rural Health Mission. Ma'am was also the editor of the CSD's Social Development Report in 2014, titled Challenges of Public Sector, under the Oxford University Press. We are truly privileged and delighted to have you with us, ma'am, and we are waiting eagerly to hear you deliver your lecture. Thank you.
Thank you. Should I start? We are already 5 minutes late. Thank you very much. Thanks to the organizers for giving me this chance. As you can see, that we have a subject which by mistake I have made it so vast that I really don't know how to look at 70 years of experience in public health. Still, I will try. This may be a subject you are not very familiar with, so I would emphasize on understanding what we are talking about and why, rather than going into the details of it, which I hope that when you publish the proceedings will become clearer when you read the journal. Let me begin by saying that there are many terms, like social medicine, community health, community medicine, public health, and very often we get confused in definitions. I think what we need to realize is that these terminologies basically are ideas which human beings have evolved with the sense of empathy and justice to provide health to a large number of people. So what we need to distinguish between is medical care and public health. Because medical care basically means when you are handling with individuals, and public health means when you are handling large number of people. And therefore, instead of dividing the two, we need to see them as one, because medical care is a very important, critical dimension of public health, because if organized strategically, medical care becomes a preventive tool to change the history of diseases. We have controlled some of them by adequate planning and strategizing, but not all of them, because we were not good enough in our strategies. So I would request that you keep that distinction in mind. And these different terms have evolved in history in different points of time and in different regions, depending upon the social context. Like social medicine evolved is a term from the European context of the 17th, 18th century histories of revolution, of sanitary movement, of workers' movement, and of a progressive welfare capitalism that was growing in those parts of time, parts of the world. I choose public health, and public health today is the more commonly used terminology because it includes health and not disease. And therefore, you have to think what keeps us healthy. It talks of public and not just narrow communities, and it talks of organized efforts. So you can have a large number of private practitioners, and they are doing also service, but they are not organized, they are not linked, they are not working together. Whereas in public health, institutions and individuals work together for the same purpose. Now, interestingly enough, in Europe and in the Western countries, public health was rooted in social movements. Public health was based on the notion of justice, fairness, and equity. And therefore, the effort was to develop a universal coverage. So the national health services in Britain grew, and the Canadians got inspired by that, and they developed their services. The interesting thing is that these experiments were varied in their content. So somebody was doing it with insurance, somebody, like in Britain, they were doing it with taxation, and you paid taxes and you pooled it and you looked after the health of other people. What is interesting about the Western history is that they had the advantage of their colonies, and they had quick accumulation of wealth, and therefore they could invest in welfare. And as you know, the history of 1930s, when welfare became the force of development, of economic development. And then there was the Industrial Revolution with technology growing, and medical technology grew very fast over that period. Interestingly, what happened is that the entire experience of the 17th and early 18th century sanitary movement and welfare movement and workers' movement, which was for improving the conditions of living, was underplayed by the growth of technology. And most of us know that believe that medicine grew because of technological growth. I would like you to remember that the development of people as a whole, the economy and the social dimensions, are a very important factor in public health. And technology plays, as I told you, its own role by providing medical care and preventive means. Now, when I look at India and I compare, it's interesting that in the West, public health was defined as the science and art of keeping people healthy, prolonging life, and giving them universal coverage so that everyone gets covered. And the focus was on medical care because there the standards of living had already improved. So where the wealth came from and where that investment came from was never a debate within public health in the early periods. Of course, in the 50s, this importance of social investments and economic growth and the role of food prices coming down was recognized by public health scholars. But in the beginning, that was not the case. The same public health when it came to India during the period of colonization, you see that it has completely changed its contours. It became exploitative. It became the means of appropriation, of penetration, of control. So it was for the military, it was for the British elite. And then when they realized that to rule, you have to have a humane appearance at least, then the so-called indigenous people were also included, but very minimally. We didn't even get the adequate doses of chloroquine when malaria was so rampant. The fact that, can you give me a glass of water, please? The fact that there was a British doctor who pointed out, and there is that report is there, the importance of means in malaria deaths was underplayed, actually hidden, to be discovered by a colleague now who has come up with a book on this, that famines played a huge role in malaria mortality, and that it is only after the famine code was introduced that malaria deaths have come down. Now, these kinds of things of how social factors impinge on public health are very critical, and a lot of work is being done on it. But in that period, there was very little. So when India became independent and we started building our own, I consider that the first period of the socialist democracy, Democratic Republic of India, trying to stand on its own, trying to build its public health systems, is a most educative, most interesting period from where we learn a lot. If you look at the 30s, the 40s, and the 50s, what you find is that, you know, in the national movement, there were doctors, there were public health people who were talking of the economic development and of how to build services for everyone. So, and I don't know if you know, but Gandhi himself with a group of people wrote a plan for health. And of course, in his perception, building village as a primary institution, giving power to people over technology. He did not reject technology, but he always said that people should have power over technology. So that, plus there was a workers' plan with the trade unions came up with, and there was what is popularly known as the Bombay Plan. So in both modernity, technology, development of infrastructure was given emphasis, but universality and how we are going to reach universality. And of course, there were differences, one wanting agriculture to grow, one wanting industry to grow. The plans got inspired by the Bombay Plan. The plans, before the plans, there were committees, the National Committee of Congress planning had a subcommittee on health, which is known as the SOKE committee, plus there was BORE committee, which has given us the blueprint for planning public health in India. So when the first and second plan came up, the second plan is a most beautiful document to learn about methodology of planning for public health and for economic processes, because this used very methodologically correct systems approach, operations approach, as Amalendu was a partner in Nehruvian planning, wherein the idea was to understand the problem, to design processes of intervention and plan in a way that you have a long-term perspective and then you have short-term evaluation. So you have a constant monitoring. And they realized that there are many things that they don't know. And therefore the feedback loops became very important because that were to be used as correctives. So they planned for economic growth, they planned for public health, and the plan for public, you know about economy, I'm not going to go into it, it's a very vast thing. The land reforms that they planned, the industrial growth, the community development projects, and so on. And these were implemented. In health, the idea was that we will have a network of primary health centers at the grassroots with sub-centers, which will be manned by trained people. Then we will have the district hospitals, and we will have the medical colleges and other institutions at the top. Because if you handle the basic primary issues, then complications don't develop. And you don't have too many cases which need a higher level of medical intervention. And then if the district cannot handle anything, then it is referred. So a reference system, two-way referral with basic care was the theme of public health as far as the 50s were concerned. Now, what happened was that there were two things. One, as we saw in the West, that the total developmentalist strategy was dissociated from public health. Now, they didn't have to worry because they had the development. But in India, it was our idealism which kept it separate, because we thought that we are in any way going to make the economic and social development. We had won the race for independence, and we believe that we will do this also. And the health planning, therefore, was again independent of the economic planning. But the point I'm trying to make is that we never emphasized the linkages, although we understood the linkages. Because if you read the BORE committee, it very clearly says that ill health is rooted in poverty and that it cannot be handled independent of poverty. Now, we were sure we are handling poverty and we are handling. So we didn't see the linkages. In our monitoring system, in the loop that we developed of seeing, there was no notion of how much development is necessary to provide this kind of development. The result of it was that we started, when the economy started failing, you see, it's a complex subject. I cannot go into the details, but we should know that up to the mid-60s, India tried. And the first two plans, if you see, the investment in health was 3.3% and then 3.2 or 1%. So we were trying to invest in health, and we were trying to reform the economy as well. Now, Nehru and Amalendu were so committed to modernity and technology that they believed that if we modernize, if we give education, if we promote science and scientific temper, then the social conflicts will be resolved. Unfortunately, that wasn't right. Unfortunately, the lessons that we could have learned earlier by linking social development and public health were not learned because we were not focusing on that. And so when the economy started doing poorly, let me say that I believe that mid-60s, till mid-60s, even though the GDP grew only at 4% rate, the distributive justice in terms of basic infrastructures growing and basic services expanding was much, much superior. And that is more important than having high growth rates which do not provide employment and economic growth. So you had, in 20th century, you had very high growth rates, but they were jobless growth rates. Your employment rates were not growing because people must eat, people must live well to be healthy. Now, therefore, this problem of social conflicts taking over, the unity that had come to win independence couldn't hold very long because the ruling party was a party of different interest groups. And if the powerful begin to feel that they need more of the gains of independence and others can wait, then people started getting restive. So when you reach the 70s, there are many things that happened. One was the slow growth rate. In fact, the sixth plan gives, and is the only plan which gives that assessment, that 0.5% of the wealth was with the lowest 10% of the population, whereas the upper 10% owned 51%. So the distributive justice was very, very slow. People were getting restive. In the 70s, see, there was crowding. We had had bad agricultural years in the late 60s. We had the social unrest and a general strike was threatening us. We also had the oil crisis and the prices were going very high. And we had the slow growth of economy. It wasn't that slow. By then, the growth rate had increased to 5%, but still, the distribution was not fair. And to contain this thing which the political leadership couldn't handle, we had the emergency, the debacle, election debacle in 77, and the return of the same party in 1980s. This is very, very critical for public health because when I look back, in that time, I'm very ancient, so I have experienced all this. We were very happy in the early 70s because we felt that we are doing better. We are making the infrastructure, we are training manpower, we are producing lower level functionaries. In the 70s, when we went to the population international conference, India had said that development is the best contraceptive. And at the same time, the only link India recognized between development and public health was numbers, the population. And the entire emphasis was on population control, not on removing poverty. But when this hit them was post-emergency, when we had 20-point program, Garibi Hatao and Waterview, but by then it was too late. It was too late because by then our investment in public health had declined. It came to 2.9 in the fourth plan, it came to 2.1 in the fifth plan. And what we did was that we started doing small interventions like the ICDS, the community health worker. ICDS is the Integrated Child Development Program. Community health worker means that we took people from the villages and we gave them short training so that they could do health work. These programs were seen as short-term programs until the economic development takes place, socio-economic development, they will not be necessary. Unfortunately, they have become a permanent reality in India, because that never, the development never came the way it was envisaged. Now, therefore, the 70s had this contradiction, a very, very serious economic situation, wherein after the emergency, the government decided to handle things with a firm hand, and the power of the states started being curtailed. So our federalism was being undermined. The investments were declining in public health, and yet we continued with the same populist welfarist language. And when you enter the 80s, you see that the first public health policy, the first health policy, I should say, that came into existence, had a flowery language, said all the right things, except that it also opened health sector to private investments and to NGOs. And this was the time when the World Bank was very happy, because they've always been, the WHO, the World Bank, the IMF, been monitoring India. They were so-called our international partners in development. And it was said that India is doing the right thing, of the directions in which it is going. It is getting integrated in the larger global economy, which meant that very soon we accepted the reforms. And once we accepted the reforms, we went into a large number of transitions, which has in fact converted the entire public health system into selling health as a commodity and not as a service. And which means if you have money, you get good health, because our investments in health came down to 0.9%. And we had to give in to the private sector to take over. So the way they took over was through public-private partnerships. And today you have public-private partnerships in everything. Sorry, you please give me a sense of time so that I could monitor myself. Nobody is monitoring. It's how much time do I have?
10 minutes more, ma'am.
Okay, great.
Thank you.
So, so what kind of reforms came? In the public system, which was the only thing for the majority of the people, and the majority here consisted of the poor, whose numbers are very large, almost more than 50% of the people. The public sector started getting shrunk because its resources were removed. The state withdrew investments. The public sector was opened to the private institutions who, as is very obvious, would want to take on the tertiary care. Tertiary care means the high-tech investments. And the rest was left to the public sector. Now, if you take away the topmost tertiary sector, you are leaving public health, because I want to refer cases for better treatment, but I don't have it, because if you go there, you have to pay, and most people couldn't do that. So you had user fee, you had opening of the institutions. Once you start saying private investment into public institutions, the implications are very serious, because then you are outsourcing your services. So investigations are outsourced, food is outsourced, laundry is outsourced. You casualize workers, then the third and fourth category of workers, that also is outsourced. It completely fragments the institution. There is no coordination of function. Earlier, if a patient was admitted at 1 o'clock, the sisters will manage food for that family because there's always enough food. But now it is outsourced. The man who comes will not give one plate extra. The quality declined because there was no control of the hospital and the food that was prepared. So I can go into great details of how it affected. The entire culture of the hospitals changed because of this penetration, because the culture of profits and private control came in. Other than that, the PPPs, the insurances were introduced. So the private insurance didn't work in this country because there weren't that many rich people to give huge amounts of insurance money. So we started on state funded investments in insurances. So center and state started running insurances. But because of the public-private partnership, most and an open choice. So you could go to a private or to a public institution, and people chose the private institutions because obviously they were better off, because they were getting entire support of the state, and the other side was not getting anything. So quality was declining, and therefore the insurance was also tilted towards the private sector. So the state support that came was equally divided upon, depending upon the share of service the private or the public provided. So subsidies were thus transferred to the private sector. Now, this means that a large number of changes have happened in the public sector. And what are those changes? The changes are that we are commodifying health. Commodification basically means that, as I told you earlier also, that services can be had if you have money. If you don't have money, then you don't get services. Now, what does this mean? This means that the costs of services will automatically go up. When the costs go up, the poor are excluded. Then, if earlier we had a two-way referral. So what they have done now is that they have said, as a very progressive gesture, they are saying, we give you autonomy. So institutions have been transformed into autonomous institutions. So what happened? The district level hospital, when they become autonomous, they have to produce their own resources. What will they do? They will only serve those who have money, and those diseases will be taken up for treatment, which are more paying. So the ordinary diseases of diarrhea and malnutrition and other infections, they will not have priority. So what happens is that in public health, it is the majority of the people, it is the majority diseases and the common people's diseases which need to be addressed. But today we are addressing the illnesses of the elite, because that is where money lies and that is what we do. So your priorities change, and your reference systems completely break down. Now, autonomy, therefore, is something that has destroyed the public health system. And in 2015, we had a draft policy, which in fact said that health should be treated as a right, and therefore it will become compulsory on the state to provide health services. Interestingly enough, the actual policy of 2017 says this cannot be done because this would mean a lot of investment in health system, and the state cannot afford to do that. It is best left to the state. Now, this meant again that public sector and public health was relegated to the margins in favor of medical care which is always generating more revenues. So with commodification, you make health services into a revenue generating instrument. And the Niti Aayog today, in fact, spells it out. And it was very angry with an expert group which said we need to invest more in public health, saying that they're ignoring the fact that health is a $160 billion industry and it is contributing to the national growth. But remember, this growth is a jobless growth and you are denying services to the common people. So the point I'm trying to make to you is that public health has been not only undermined, but it has been transformed. The very basic concepts of public health have been mutilated. And we need to understand what is that mutilation. And I would like to underline the fact that the position that today the state is taking, that you put public and private together and count them in your universal health care, and that makes a system, is completely wrong, because public and private have different objectives. One is for profit and the other is for service. And unless and until your regulatory mechanisms are so strong, like in the 50s and 60s and 70s in the Canadian system or the British system, you cannot control them. And we have seen this in the period of pandemic, the behavior of the public sector and the private sector. So this distinction has been completely ignored. And this means that the systems approach, which in the initial period was the way to look at public health, has been destroyed, because now you have two components, both conflicting with each other, destroying each other, and the weaker one submits to the power of the more powerful one. So we have now a uniform system of a business model of health services. The state has given up its role of providing services. It no more takes care. It only provides coverage through insurance systems by subsidizing the private sector. Efficiency, again, is no more counted as how many people we are treating. It is counted at how best my money is spent. So this notion of efficiency, which takes coverage out of its notion, again, is an economic rationality. It's not a public health rationality. Interestingly enough, up till now, economics has been teaching you a definition of public goods, which meant that there are certain goods which are non-contestable, which we can consume without denying the other person. Even this definition, they have attempted to change it, and they are today trying to define public goods as non-contestable goods as goods which cannot penetrate the market. So obviously, all the preventive services are not good for the markets. So sanitation is not good for the market. Keeping people healthy in terms of food provision is not good for the market. So it is the market which is defining and not the competition between users. So non-contestability has been completely changed. So what has become of public health? Today, it has become a means of earning revenues, a means of controlling population, and a means of removing public participation and public taking public in confidence when you are setting policies. So is this the kind of public health that we are looking for? Certainly not. Certainly not, because as I said earlier, the initial definition of public health was that it is the organized system which is reaching out to people. It is organized by the people. So in democratic society, certainly by the state, and therefore the state has the responsibility of reaching out to everybody in terms of medical care and providing conditions which are conducive to health, which require a social and economic development. Now, a lot of people think that, we can go on making fragmented, piecemeal interventions, which certainly is welcome. It must continue. But I believe that we need to think of the total system. We need to move away from this business model of public health, which focuses only on medical care and technology, because technology then is an area of more and more business and revenues, not health. Now, if you want to move away, what are the ways? Are the doctors doing it? I believe that we are I'm a doctor, I've been through it. I know that we are so walled in our hospitals and we feel so good treating patients. We have no time to think of the larger issues. And we are treated, not anymore, but there was a time when we were treated like gods. So we have no time. There are very few, a handful of people among the profession who are raising these issues and thinking of these issues. And yes, that tribe is increasing, but I think that we need more help, and we need help from outside. We need help from you, all of you, from different disciplines who can look at the complexity that is the system of public health from outside. And of course, you will have to first make your choice of which definition of public health you accept, the business model of public health or the initial concept of universal health care through the organized system which looks after everybody and is supported by the conditions of living, the living standards. If we do that, then we need interdisciplinary social sciences. We need inclusion of the social dimensions into the vision of the public health system. How does caste, class, gender, religion penetrate the system through its workers and through its users and through the social context of countries which are giving us the technology that we are using? So please don't think that the international forces are not important. They're all there all the time intervening. So you have, even WHO has changed its stance ever since financially it has come completely under the control of the United States. I can't go into the details, but that is a reality. Then you have the World Bank, you have the IMF, and now you have so many private international financial donors. So I'll just end with 3 examples, or maybe just 2 examples. One is where this kind of approach really gives us a different vision. Nutrition, I believe, is very much a part of public health challenge. And if you look at the current national family health survey, you know that the condition of nutritional status of women and children has worsened from the previous survey. So we are going downhill. The interesting thing is that historical data shows that the heights of Indians, which actually heights are actually seen as indicators of the well-being, the social economic well-being of populations. And over the past 100 years, we in India have grown in heights at a minimalistic rate compared to other countries. So if in South Asia, they grow 20 centimeters over the period, we grow 6 centimeters. So this is the difference. In none of the official nutritional debates, this issue is ever raised. But if you look at the recommended dietary allowances, the calorie recommendations over time, over the last, since 1990, they have been declining. And it is said that because of the development, because of the technological thing, because of transportation, because of technology in working places, the Indian working class does not need higher calories. Now, this is a terrible misinterpretation of reality. And economists, anthropologists, public health people have got together to look into this. And we find that this is not correct. That what is actually happening is that there is something called adaptation. Your body adapts to deprivation. And there are different levels of deprivation. And that we in India are accepting levels of deprivation which are extreme. We are not only accepting it in our policies, we are using it to rationalize things, to rationalize that we have lower poverty because that is a measure of poverty, to rationalize that the numbers of poor are very low, and to rationalize that children should not be given eggs in school because if they take eggs, they will become diseased. Now, the whole trouble is that nutritional deprivation in a young child actually leads to non-communicable diseases in the older age if it is not corrected. So first of all, we don't correct malnutrition in children. And then when they grow up, we say, don't give them eggs. So this is the kind of logic that public health is following these days. And I think we need social scientists to intervene, to think, and to participate in rebuilding public health. Thank you. I'll stop there.
Thank you so much, ma'am, for your very critical intervention on a very important issue for India. And there is no doubt that the universal healthcare has to be state-led, integrated, and inclusive rather than exclusionary and entirely market-based, as you have propounded so wisely. So thank you so much. Since we have our next speaker here and there is a slight paucity of time, we shall only be able to take one question. So I invite anyone to please raise their hands or type your questions in the chat box. And I'd also like to mention that ma'am is a prolific writer. She has written several publications. She has several publications. Some of them are also in the public domain. So all our interested readers can please access that via the internet and please enrich themselves from ma'am's interventions.
Devangana, I think Kajal has raised a hand. You can just ask her for one question and
yes.
Then.
Kajal, please go ahead. Please ask your question from ma'am.
Yeah, I'm waiting.
Yes. Kajal, please unmute yourself and ask your question. Tejinder sir, if you could unmute.
Yes, ma'am, she can.
Hello, ma'am.
Yes.
Good morning, everyone. Ma'am, my question is about regarding the health literacy. Like in the context of India, there is a lot of miscommunication between the patients and the doctor. So there is a lack of health literacy in India. So I would like to know your viewpoints regarding it.
I think the policymakers need more health literacy than the people themselves. What do you mean by health literacy? Are we going to tell them to drink boiled water? Are we going to tell them to use sanitary toilets? Are we going to tell them to eat good food? How many people can afford these things? Do you believe that people really do not know? Yes, I know that some people don't know many things. Many mothers don't know how to bring up babies. So you have to tell them a few tips. But for generations, people have been living in this country. To believe that the fault is there and not at our end. You see, if you were providing them everything and then you saw gaps, then you give them literacy, they accept it. There are things that they are crying for. They want A, B, C, and we are not able to give it to them. Then we go to make them literate. Let me give you one small example. During the second wave of COVID, we were trying to reach out to the communities. And one was very confused about immunizations because, the information was coming and sometimes contradictory and one didn't know. And there was a pressure that people should motivate to get vaccinated. Now, when you go into the community and you are yourself not sure of the booster dose and its value, and you look at the literature, and I'm not talking without reading, you look at the literature on the value of the booster doses, we still don't know. And we are being told that you have to tell people. And today, public health bill is going to come where the state will have the power to come into your house, pick you up, take you anywhere, separate your family, occupy spaces, do anything that they want to do. So when we went to this community and we talked, they asked me, and the people who are working there, they ask me that when we go and tell them this, people ask us that, can you promise me that if anything goes wrong, you will come to take me to the hospital? Now, can you answer this question for me, please? And if you can, then yes, we will do health education. But till then, there are many other priorities. You see, it has become very easy to do things which are possible and not to do things which you don't want to do. And that is exactly what the international agencies are doing together. Today, to third world countries, the technology that is available will be sold to you to use, whether it is in an epidemiologically relevant disease or not is irrelevant. But that is available, you take that. So health education is available, easiest thing to do. So we will give that. But we will not give basic medical care. So you have to combine health education with basic services. Then it is accepted.
Thank you so much, ma'am. If there are any other questions, Ma'am, if you could share your email ID, will it be all right if you share, and if anybody can write to you regarding their?
Oh, sure. Most welcome. You already have my email ID.
Yes, ma'am. So can we share it with the general?
Of course.
Thank you so
Most
much, ma'am.
welcome.
Thank you so much.
My pleasure.
It is now my pleasure to hand over the proceedings to my friend and colleague, Dr. Neeraj Kumar from the Department of Sociology. So over to you, Neeraj.
Thank you, Devangana. So, good morning, everyone. It is my privilege to take you further in this session. In the same line, we have another eminent speaker with us, Professor Amalendu Jyotishi, who is a professor of economics in Azim Premji University. He had also been associated with Ohio University, Christ College Academy, PECS University, Hungary, Gujarat Institute of Development Research, and CEPT University, Ahmedabad, in various capacities of a teacher, researcher, advisor, and a guide. He works on issues relating to natural resources and institutions on the one hand, and innovation, entrepreneurship in information technology business on the other. He studies them from the perspective of institutional economics. His areas of interest are natural resource management and commons, agriculture and development economics, new institutional economics and legal pluralism, economic and ecological history, urban food security and malnutrition, and ecosystem and livelihood issues. His current portfolio of research interests include fish for food and security, dried fish value chain, subsistence economic models, and commons. He has written extensively in various journal articles and books. He has been acting as a reviewer for several reputed journals. He was also an executive member of Indian Society for Ecological Economics from 2018 to 20. He has collaborated in research projects supported by organizations like the Netherlands Organization for Scientific Research, Swedish International Development Agency, the World Bank, International Water Management Institute, Oxfam Trust, Aga Khan Rural Sport Program, etc. We are privileged to have you amongst us, sir. Today, Professor Amalendu will speak regarding blue economy. The title of his talk is Fish for Food or Fish for Feed. He will address questions like how the indiscriminate biomass fishing constituting a new manifestation of cheap nature commodification, how the FO industry undermines the viability of small-scale fishers and local fish traders who are competing both at sea and land. And last but not the least, how the industry converts cheap small fish into high stamp value commodities and hence compromising on domestic nutrition security. Over to you, sir.
Thank you so much for such a generous introduction. And I'm really privileged two ways that you invited me to give a talk on this important topic in this conference, and more privileged that it's Professor Imrana Qadir who preceded this, because she had already set the context so well. And I'm unfortunate that I could join only in the later part of it, but I could understand the gist of the kind of situation the country is going through, particularly when it comes to health and nutrition security issues. And there are political dimensions associated with that. So that's such a well set context for me to kind of get started with this particular topic on fish for food or fish for feed. It kind of builds on that specific one context for sure. But in addition to that, of course, we are also looking at a couple of other dimensions which are indirectly related to food and nutrition security issue. One is the livelihood dispositions that is happening and ecological disposition that is happening through this kind of interesting value chain or blue economic models that is coming up in the coast. So can I share my screen? I think, right. I have a small, yeah. Can you see my slide and can you hear me properly?
Yes, sir, you're audible. We can see the slide.
Right, okay. Let me full screen mode. Yes, right. So, so this is the topic that I would be delving into it in next 30-40 minutes. And sorry, something wrong. Yeah. So this particular work is part of a larger network of people that we have been working. I'm not the only one to take claim over this work. There are several collaborative projects. One on dried fish matters that is up and running actually. And we are doing this study across 7 South and Southeast Asian countries. And I'm also part of that, largely studying in Karnataka coast. Also part of a SSRC project on basically in Indian Ocean region. We're looking at small-scale fishes issues. And but the ground setting of this work happened when we started working on this particular aspect called fish for food. Or basically we try to look at how fish can play an important role in food and nutrition security in the urban scape. And the study was conducted in two countries, in 2 sites each, in Ghana and India. And we looked at coastal and inland cities in both the countries' context. In India, it was Chennai and Bangalore particularly. So, so there are several people who are part of this in building up this, the kind of arguments that I'm trying to make today. And hence, it is just not my own work, but I'm just a representative of a larger body of interactions, knowledge, support, which led to this one interesting work. So to set the context, I'm not sure how many of you would be eating fish or how do you view fish. And I'm also not sure how many of you are kind of familiar with the coastal areas and marine ecosystem. But the coast, particularly in Indian context, in recent years have been quite a vibrant situation, we can say. Vibrant, you can take it in a positive sense as well as in negative sense, depending on which direction you come from. So there are a lot of marine activities happening. There are varieties of activities happening in the coast, including tourism, hotels, resorts, aquaculture, and number of things. What we call is the part of blue economy led growth. And this also has several repercussions. And we are not among the people who see that these blue economic led growth models are equitable and sustainable, and so we are critical about these things. So maybe we are a small group of people who think that way. So this fish for food or fish for feed is kind of set in that kind of a blue economic context, and we have some pertinent questions that we are trying to kind of look at. Is that when we are trying to see how the fish utilization had changed over a period of time, and particularly in last 1 decade, it has the change has been rapid, and we're trying to know who has access to fish at the sea, who has access to fish on land, who controls this fish chain, and then what is the trend that is there in this fish utilization, and obviously what are the implications of this kind of a chain that is happening. And the implications that we are looking at from probably 3 perspectives: from ecological, livelihood, and food and nutrition security, dispositions perspective. So how this all happened? Actually, the project called Fish for Food was quite an interesting project we started with, though we had experts in our team who have been working on coast, on fisheries and fish gears, those related issues. All of us were kind of new to this idea of how fish is being consumed, and particularly in the urban scale. And that led us to see or understand the fish value chain, not only from the fish catching to landing to how it is going to different places, but also from the consumer's perspective, and particularly focused on the low-income consumers. And we try to triangulate our data and information from the consumer side as well as from the landing side. And that led us to very interesting set of questions. What kind of fish is being eaten by whom, and what kind of fish preferences are there? What are the competing dimensions of fish as food vis-a-vis other animal protein as food? And in the process, while looking at among the low income, while working with among the low income consumers, we also looked at fish retail markets, fish wholesale markets, and also fish landing sites. And one of our PhD scholars, Subramania, when he was in Kadalur, one thing that surprised him is that Kadalur is in Tamil Nadu, in the east coast of India. So he saw that a lot of fish is going, kind of getting loaded into the trucks, and most of these trucks were bearing the Karnataka number plate, and most of these fishes were essentially sardines and anchovies, small fishes, and they were taken in that direction. And also saw that the women who are waiting there to buy their fish in this landing site, a lot of them were kind of disappointed for not getting enough fish. And these women are essentially who take this fish and sell it as fresh fish, and sometimes they take it and process it for drying, and then dried fish is being sold. So these are the set of women who are kind of seen who are getting disappointed for not able to get enough fish. And that in some sense kind of triggered us to see that where this fish is going and what are the kind of transition or changes or new development that we are trying to see. And then following that, I, along with also a couple of my colleagues, we visited Mangalore and figured out there are a number of fish meal factories. In fact, there is a cluster in Mangalore, a place called Ullal, about 14, 15 factories which have come up in last not more than a decade. I think some of them are more than a decade old, but a lot of them are just a decade old. So these are the fish meal factories. So we use this term called FMFO, which means fish meal, fish oil, where in this factory, all kinds of fish come, and there is a centrifugal machine through which you kind of extract the fish powder, fish paste, and fish oil. And some interactions with them suggested that a lot of this fish is going to shrimp farms. So that kind of set the context for us. And also it was a little odd for us to, there has been very little discussion around it. This is around 2018-19 that we are talking about. And the discussion around fish meal and all those were limited, and particularly very, very few in Indian context. And that led to our curiosity to understand that there is such a huge activity that is happening and we know so little about it. And so when we are still struggling to join these dots that fish is landing in very many landing sites and going to these fish meal factories. And then we also saw that this fish meal is demanded by shrimp farms. So we tried to kind of join these dots to see, understand what is the kind of situation that is happening. To set this context, what you also would see that it kind of juxtaposes well with the global scenario, the kind of change that is happening. what you see is that the capture fisheries, both at inland as well as in marine waters, it has been more or less stagnant over last 2 to 3 decades. So we are producing as much that we are doing 3 decades ago, both in the inland as well as in marine context, and especially in marine context. But what you also see is that the aquaculture has been, this has been kind of expanding over a period of time. The expansion, you can almost say that is an exponential kind of growth that is happening to aquaculture. So capture fishery is stagnant and culture fishery is expanding. And fish eats fish to survive in a simplistic term, if I have to put. So the expansion of aquaculture also is dependent on the capture fisheries that comes largely from the marine sector. So there is an interdependency that is there that we see. And in this, the biomedia role is played by something called aqua feed, and fish meal is an important ingredient in this aqua feed. So some of these aspects we were able to capture and understand that, okay, almost about 20% of wild capture fish is used for producing fish meal, and that goes to as aqua feed, and largely to these high value fishes like salmon and shrimp. Right. And then this a report came by Changing Markets, and it was surprising to see that we know that there are traditional players in fish meal and fish oil like Peru, like Chile and China, but India coming in this top 10 category was quite a surprise for us. And that was around the time when we are engaging on this particular topic that we saw that Changing Market came up with this particular report saying that almost you can say 10 million tons of this 100,000 tons of fish meal and about 26,000 tons of fish oil is being produced by India. So it's one among the large players. At the same time, there has been a shrimp revolution also in India. So if you look at this shrimp data, this data are not really easily available. So one has to kind of borrow to CMFRI, Central Marine Fisheries Research Institute, to find the extent of data. And of course, export data are generally easily available and accessible through this organization called MPEDA, that's the Marine Product Export Development Authority. So what has happened in these recent years that there are two types of shrimps. So one used to be called tiger shrimp that was being produced for export purpose generally, but that has kind of stagnated or declined, in fact. And there is a new type of fish called white leg shrimp, or venomai, that is what they call it. That has increased exponentially. And one of the places where its intensification has grown significantly is in Andhra Pradesh, particularly this Godavari Delta, Kakinada, and that region that you will find a huge number of aquaculture farms that have come up adjacent to the sea, near the estuarine of or the delta of Godavari, and producing huge amount of shrimp. And most of these shrimps you will see is that almost 90% of it is for the export market. So very little that is used for the domestic market, but a majority of goes for export market. The export markets are in North America, in Europe, and part of like Japan and East Asian countries. Right. So, so these are the different dots that we saw, and then we tried to understand this fish meal. Broadly, there are two chains that we see in the fish meal. One that we had, means people have been observing it for a long period of time, that there are certain kinds of discard fish, or particularly in the estuarine areas, you'll find small shrimps which are not generally consumed and consumed by human beings. So they dry it, and those were kind of sent to poultry mills or to the fertilizer as fertilizer, and it is used as poultry feed. A place called Nagapattinam, particularly in Nagapattinam in Tamil Nadu, where not Nagapattinam, sorry, the name would come to me later. So they're like these poultry farms which consume a huge amount of this as feed. But that was not so surprising to us. But what was surprising to us was the industrial chain, the large scale of the fresh fish which were taken by the agents to the fish meal factories. The concentration of fish meal factory has been largely in Mangalore coast or Karnataka coast, you can say. And Mangalore itself has about 14 to 15 factories, but they are also spread across in other parts of Karnataka coast, including Kundapur, Honavar, Tadadi, etc. But in recent years, in last 7-8 years, we have also seen that these fish meal factories have come up in other parts of India too, including Maharashtra, Tamil Nadu, Andhra Pradesh, Gujarat, etc. So there has been a kind of growth of fish meal factories that is happening, and these fish meal factories have certain capacity, and they try to get as much as fish they can, and largely they get it from this the large scale fishers, the trawlers and purseners who bring a good amount of this catch and sell it to them. And it almost works like a minimum support price for the trawlers. 40 to 60% of their fish goes to these fish meal factories. And this terminology is quite interesting when we talk about it as a trash fish. So quite often it used to be called as bycatch, because when you catch certain kind of valued species for human consumption, there are certain other species do come in, and which generally are not preferred by human being, or it's not appropriate for human consumption. So those fishes are called bycatch, and they go for kind of other activities or any form of reduction. But what has happened in recent years is that it is not anymore a bycatch. There has been a target around that, and the fishes in the sea, particularly the large-scale fishes, the trawlers and purseners, have been targeting to get a sufficient amount of this kind of species, and which includes a large amount of juvenile species too. And because there is a price for it, there is a value for it, there is a market for it, and that has in a way led to a target kind of catching. And so what is the kind of terminology we'll be using was always confused, and the terminology has its own politics also. If you call it trash fish or low value fish or bycatch or waste, it means differently than when you know that you call it reduction fisheries or low market value fish and targeted fishing activity. So that's a kind of situation or things that we observed during our field visits in various parts of the coast, but especially in Karnataka and Tamil Nadu. And we tried joining these dots. So it was quite interesting that the exploration started in Kadalur, where we saw that a lot of this fish is getting loaded into these trucks, and they're going to Karnataka and to these fish meal factories. And these fish meal factories then reduce this fish. In the third photograph that you would see, it's like there are machines where they and they are indifferent to whatever kind of fish that comes, juvenile or large fish, small fish, but most often they are small and juvenile fishes that they kind of put into this centrifugal machines and make this fish meal out of it. This fish meal is then is added to the various other items to make what we call the aquafeed. And this aquafeed is then used in this aquaculture farms that you will see across the coastline. You will find many places, but particularly if you go to Andhra Pradesh, you will find the numbers and scales are huge. And where these shrimp farms have been kind of nurturing these shrimps, and they produce at almost like industrial precision, and those are then processed and then sold in the markets. And the last photographs of this shrimp that you are seeing in the packaged, we got this from one of the supermarkets in Amsterdam. Thankfully, because our team had different sets of people, so we could trace this value chain by following the fish. And this revealed to us varieties of interesting dimensions of fish for food versus fish for feed. First question that we encountered was that what is the magnitude of fish meal that is being produced, and we didn't have a clear-cut answer from existing data, and the data were quite contradictory to each other. Like different sources provided us different kind of information, and we are not in a position to kind of estimate how much fish meal perhaps would be there. And while we are struggling through this process, because we talked to fish meal companies, we were not able to identify what is the exact number of fish meal companies. The information that is given in say MPEDA website, the numbers are not tallying with the numbers that the Fish Meal Fish Oil Export Association people talk to us about. And similarly, we couldn't figure out that what is the capacity of these plants and how the capacity utilization, because there is a seasonality, there is a variation that happens, like there is a fish ban period, and during that period, this fish meal companies barely operate, whereas there is peak seasons where they operate in full capacity. So finding this kind of getting into an estimate we found it a quite a horrendous task. And perhaps that is one of the reasons that we get different kinds of numbers from different sets of estimates, or different organizations providing their estimates. So that's the time we actually, when we are thinking that it is almost impossible to assess how much is the magnitude of fish meal and what is the kind of live weight of fish that is getting into fish meal. We also found that there is a way to do a backward calculation, and in a simplistic form, that how much raw fish is required to generate sufficient fish meal to produce this much tons of shrimp. So we know that with only looking at shrimp, we are also ignoring various other aquaculture where fish meal is used for feed. There are poultry farms where fish meal is used as feed, but even ignoring that, we're just focusing on shrimp because shrimp is a highly export-oriented commodity. Our government is also kind of banking on them, that it's a $50 billion export-oriented economy, and they want to increase it further, and seeing as a champion for the blue economic export-led growth. So somehow these numbers are relatively easily available. And since we know that a majority of it goes for export, so these numbers are also a little more reliable compared to any other numbers that you get. So this led us to kind of do a backward calculation. And for that, of course, we depended a lot on literature and also talked to a number of people in this part of the value chain. Like we talked to aquafeed farms to identify what is the percentage of fish meal is added to their aqua feed. We also we talk to the shrimp culture, aquaculture farms to find out how much shrimp feed they put to this to feed these shrimps. So, and also talk to these fish meal factories to identify how much raw fish is required to produce a certain amount of fish meal. And these numbers, these ratios were broadly similar across talking to different sets of people, and also literature supported that idea. So we found that these numbers are not off the mark. There may be a minor variation, but like say 20 to 25% of fish meal is added to the aqua feed. And so, and similarly, how much shrimp feed is required to feed the shrimps. For 1 kg of shrimp, you need about 1.2 to 1.6 kgs of shrimp feed. And how the 4 to 5 kg of raw fish is required to produce 1 kg of fish meal. So there was minor variation, but we still know that we are just looking at shrimp, and we are ignoring any other aspects of fish meal being used for other purpose. So we knew broadly we are underestimating it, and still it gave us a remarkable number. So for 2019, that we were calculating about 680,000 tons of shrimp that was produced through shrimp aquaculture. And using these conversion ratios, also taking into account the net imports and net exports, we reached to a number which comes to about 1.2 million tons of raw fish that is being used for fish meal purpose. Right. So that number was quite mind-blowing for us, because this number was off the mark from all that other reports and others were suggesting. So just to show you how we went about doing this calculation, was this the simplistic arithmetic way of doing the calculation to reach to this number of 1.2 million tons. So what kind of transformation has happened with this? You can see that we are exporting quite a bit of fish, and the black part of the bar diagram that you will be seeing is that is shrinking, and that is basically fish available for domestic consumption, and that is shrinking. And what has taken over? The direct marine export that we are doing, also export of small fishes that we are doing, which is embedded either in fish meal, surmi, or shrimp. Right? So we are directly exporting fish meal. We are also exporting shrimp, and we are also exporting something called surmi, which is basically the skins are sliced, and only the meat part of the fish is packaged and sent, and largely consumed in countries like Japan and many other North American countries. So these things have increased over a period of time, and what is shrinking is the domestic availability of fish for domestic consumption purpose. Right. So what implications these have on our 3 dimensions that we are talking about? One is that there is one aspect that we could see is that the nexus between the large-scale fisher, that is trawlers and purseners, with these fish meal companies, right? So, and the trawlers over the year, we should also understand this from the perspective that in the last 2 decades, the marine fish production, whichever data that you may look at, would suggest that it is stagnant. So the official data from CMFRI suggests that about somewhere between 3 to 4 million tons of fish is being landing in various fish landing sites. So broadly, the fish landing in India is stagnant for last 2 decades, but the number of fishers have increased. People who are going into the sea, And of these, the large scale fishers, particularly who take those big trawlers and purseners, where a number of fish workers are there who work there, that is increasing, and they are getting a larger share of catch. Whereas the small scale fishers, even if their numbers are increasing, their catch is their share in the catch is reduced. So that has created imbalance or inequity, that the small scale fishers are getting less fish. They are not able to kind of sustain themselves. A lot of them are also becoming fish workers in the trawlers and purseners. So that's a kind of inequity that we can see in the sea. Apart from that, the biomass that is available, or the fish that is available, also being limited, everybody is kind of competing to get the fish from there. And in the process, getting sufficient fish for food purpose is becoming a challenge. And the purseners, particularly, even trawlers do that. They are trying to catch as much of fish they can, because they know that even if it is not appropriate for food, or there are a lot of mixed species do come in, or the species come in a condition that the consumer for food would not be appreciating. So all this fish does have a market, and fish meal companies do provide that. The nexus is even more interesting, because one side that it is promoting these trawlers and purseners to bring enough of this so-called reduction fish, going for reduction fish, because there is a market for it, and indiscriminate catch also is happening. We saw, or also various other literature reported that about 50 to 90% of these fishes are juvenile fishes. Essentially, these fish are not growing to their appropriate size, and which may have a repercussion again on the biomass and the ecosystem. And in addition to that, also there are interesting nexus that one could find, that the fish meal companies' agents directly getting in touch with the trawlers and purseners, and when the catch is happening, that's the time almost it has been settled that they want the fish. Sometimes they pay in advance to get this fish. In addition to that, a third type of nexus that one sees is that a lot of these fish meal, fish oil company owners also do own trawlers and purseners. So they have a tendency to catch the fish going for which will directly get into their factories. So it is no more a bycatch in the sea. It has been targeted, and that has a tremendous implication on the sustainability of marine fisheries in Indian Ocean water. The third dimension also of the ecological disposition that we see is that the shrimp culture, the growth of shrimp culture, also shrimp needs some amount of saline water, quite a good amount of saline water. And so when the fertile delta land, which were earlier used for paddy cultivation and other kinds of cultivation, when they are converted into these aquaculture farms, it not only affects that particular land, but also affects the lands adjacent to that, where the salinity level increases. And once the salinity level increases, they become unfit for the traditional paddy cultivation. So also there was another interesting report by PUCL, you might have heard that, People's Union for Civil Liberty. They did an estimate that of course, the shrimp farms use labor for these aquaculture farms do use labor, and most of these laborers are essentially migrant laborers. But the substitution that happens, the paddy field where the laborers used to work, the ratio is somewhere around 1:5. For every one employment generated in aquaculture, 5 people lose their job in paddy field because the paddy fields are not fit for growing paddy anymore. And the losses are also quite gendered. So if you find that in the paddy field, the people who were working as laborers were mostly women. In this aquaculture farms, you'll find the laborers are mostly men. So it is also gendered in that. So that is another dimension of ecological disposition happening, quite strongly intertwined with the livelihood aspect. This livelihood aspect is a lot more staggering. In a traditional form, if I have to say what is the capture fishery is one of the oldest professions, you can say. It resembles hunting and gathering. And in this, traditionally we have seen a kind of a division of labor. It's the men who go to the sea to do fishing, and the moment fish lands, from there the women take over. So among the fishing community, we'll see that very clearly, that women take charge of the fish the moment it lands. They decide what form it has to be sold and where to be sold. And then some are sold as fresh fish, some are processed further and sold as dried fish. And dried fish is particularly important because drying is one form of preservation, quite a harmless form of preservation, you can say. And it can stay longer, so it can go to the hinterland too. And we also know that particularly in the tribal areas and as well as in the plantation areas, the dried fish consumption is pretty high. Right, so it is one of the cheap and very important source of nutrition for this set of people. And so these women play a very important role in this traditional way that fish has been kind of moving from landing to the plates. So what is happening now is that there is less fish available for these women to, and they have to compete with these fish meal factories to get their share of catch. So in simply put, that we are at 3.5 million tons of fish we are catching every year, and that is more or less stagnant. And of this, now 1.2 million ton is going to fish meal factories. So others have to compete to get the remaining amount of fish. And of this, the exporters, they have their agencies to take the high value fishes. And then this women become last in the line to get whatever fish remaining available for them. And even if they are going to pay a higher price for food, fish as food, but it is the bulk selling that kind of makes it lucrative for these trawlers to give the fish to the fish meal factories. So that is in a way leading to some amount of livelihood dispositions. One is that it is making these women who were entrepreneurs in many sense, they are becoming either they are getting out of the job market because their enterprises are they are not able to get enough fish, or some of them are becoming fish workers. So from entrepreneur to becoming workers. So this disposition is kind of affecting a good number of women. Almost 50% of them are women who are engaged in fish post-harvest fishing activities, and they are getting dispossessed from their livelihood. At the same time, the small-scale fishers are also finding it difficult to get enough fish because they have to compete with these big trawlers and purseners to find a catch. And in that, the boat size in a way determines how far in the sea you can go. And there is less and less fish available around the coast, and they're not able to get enough of that. So there is a livelihood dispositions happening to the small scale fisher in this competition in the sea. And some of them are also either getting out of this job market or getting into something else or becoming jobless, or they are becoming fish workers in these trawlers and personas. So that is the second level of disposition that we are seeing. And third is the most important dimension, which kind of I would take it from Imrana Qadir, that the impact of it is tremendous in terms of food and nutrition security. I'm sure you already know about that, that India's position in this, whatever indicator you just choose in terms of malnutrition, that in stunting, wasting, anemia among the women, all those indicators are kind of put us in precarious situation, and our performance has been dismal in this particular context, and especially addressing this for the children has been terrible, and we are kind of embroiled in the politics of egg should be given or should not be given, who should be giving, all those kind of questions are also there. The politics of food itself also kind of manifests itself in different forms. So in that, if this fish meal factories and shrimp farms, what they are doing is basically converting the low price, affordable pelagic fishes, which could have been used as fresh fish or as dried fish, and that can go to the hinterland and has been going to the hinterland for a long period of time. That is becoming dearer, that is becoming costlier, or the availability of it is dramatically declining. And it directly impacts the nutrition security aspect. There are many studies who have been kind of suggesting that the marine fishes, particularly the small pelagic, is the nature's superfood, and name the micronutrient and the vitamins, omega-3 fatty acids, zinc, vitamin B12, all those elements, iron, all those elements are quite richly present in the fish. And in dried fish, there is barely any nutrition loss. In fact, in some studies suggest that the nutrition level are higher in dried fish too. So these fresh or dried small pelagic fishes have been the source of nutrition for a large number of people as an affordable food. And with this kind of a utilization shift, which has been dramatic in last decade, and exponentially it has been shifting from food to feed, and leading to huge the issues of what you call nutrition insecurity, and which would have a tremendous repercussion going forward for our overall food and nutrition security issue. The photograph that you are seeing is that that was an experiment that was this organization called Nilachal Seva Sansthan in Odisha, where there is a home for destitute, basically, you can say that, where orphan children, women, and old age people stay there. And there the experiment of provisioning of small fish for food was done, and children really liked this, and as a delicacy it worked pretty well. And Odisha government with the World Fish Organization, there's some little hope that I'm trying to share with you is that they work together to see that how small fish can be used for food and nutrition security issues. And right now there is an experiment, there is a pilot that is happening in one of the districts in Odisha, Mayurbhanj district, where in 20 ICDS program, they are now providing fish, dried fish and fish powder to children and adolescent women. And hopefully this kind of state intervention, not only in ICDS, but also in midday meal program, other hostels where the state welfare department and ministry works. I think these are the places where fish can go, and that can play an important role in at least addressing some of the nutritional insecurity issues. And if this value chain can be straightened through that this fish is provided by these women who are processing it, and it is captured by the small scale fishers, then perhaps we can see a line of hope there. But what is happening at this point, it's largely industrial catch leading to going to industrial agencies, and fish is via shrimp and kind of getting exported, not to the poorer people in the developed countries, rather to the elite of the developed countries. So hopefully this line can be changed and altered to think of a better society where this ecological livelihood and food and nutrition dispositions can be altered. So that's where I will kind of broadly conclude my talk, and I'll be happy to take any kind of question. I'm sure I didn't do justice speaking about many other things, but also kept a timeline in mind. I hope I have not gone beyond the timeline, Neeraj. So I'm happy to take any kind of questions that you may have, and perhaps address those through answering some of those questions, if I know. Thank you so much. And so I must acknowledge this, and you might have seen this very beautiful sardine drawing sketch, and the artwork was by P.R. Celestin, who did a remarkable work in this sketch. Thank you so much.
Thank you, sir, for such an enlightening address. It was
maybe you can take a few questions that are there in the chat box.
yes, ma'am. It was really an enlightening address where you spoke about the three repercussions: the ecological repercussion, the livelihood repercussions, and the repercussions related to food and nutrition security. And it becomes extremely important in countries like India, where most of the people, they are poor and they depend on the nature for their food. All these repercussions, they are related to each other. We are really running short on time, so maybe quickly we can take some of the questions which are there in the chat box.
Okay. So what is FMFO? Actually, the fish meal, fish oil industry. That is what I was talking about, and we kind of put it as a abbreviated form as FMFO industry. I think that was clear. The other question that was, is there any policy designed by NABARD and MPEDA for sustainability of our aquatic resources? There has been some attempt, at least. I will not say that there is no attempt that is there. From MPEDA side, particularly, we saw a report which suggested that we will not allow any further expansion of fish meal industries, and not in capacity and not adding any more industries to it. I'm not sure whether in practice it has been working or not, but at least the thought in the policy itself is in the right direction. So now we have to think how we can reduce this. In terms of NABARD's position, NABARD also has been playing an important role in, if you have heard of FPOs, the Farmers Producers Organization or companies, where some kind of collectivization is happening. And the same thing can be extended, and being extended to a very, very limited extent to the fisher producers, particularly the women group, if they can be organized. If not NABARD, similar such organizations can play an important role in organizing the collective of these fisher producers, particularly the women group, and that can kind of get into the collectivization itself can help in empowering the community, at least in some sense. We don't know what implications and how far they will be successful, but at least starting that would be a good starting point. Is there any advancement in technology for capture fisheries in recent years? Yes, not only advancement of technology, the one of the process through which we observe that is that what is the size of the engine, or what is the capacity of the engine, and what is the size of the boat. And these are obviously increasing over the period of time. But what is interesting is also the kind of gears for catching the fish, that is the nets that is being used for catching the fish. So if we had more of trawlers who kind of spread their net and then try to catch the fish and leave it for a long time and overnight and then bring the fish. But purseners are kind of, they enclose the area. And so that kind of technological change leads to biomass catch instead of catching, the fish we call it school of fish, right? So catching a particular school of fish, targeting that, instead of being, what is happening is the biomass catch, and that would have a implication on aquatic diversity, and one fish is dependent on another type, and that may have further tremendous ecological implications. So those problems are there, and a lot of these forms are also, though there is a legal specification around the size of the net and a variety of other things are there, but you would see that there are illegal forms of usage, like people using all kinds of say neon lights or light catching, that is what we call, or the reducing size of the nets. So those kind of problems are there, which are being barely monitored. Right. So any other question? Fish powder and other transformed fish products become more helpful in growth in children than giving raw fish to them, and why there was a need to transforming raw fish to fish powder and other products. See, fish as a fresh form has its limitation, because it has to be consumed like vegetables, it has to be consumed at a particular time. Otherwise, it kind of deteriorates fast. Otherwise, you need some kind of process to preserve them. And drying or processing, like making powders out of that, is an interesting form of processing. And these are harmless. The second thing is that salting, curing, drying, these are a form of preservation that has been traditionally being used. Secondly, it helps actually reaching to a hinterland, which otherwise the fish fresh form reaching there becomes a lot more difficult. And a third advantage is that when you are drying it, actually you are also using the fins. So, or powdering it, we are using it the fins. So that's why the small fishes are a lot more nutritious, because you eat it as whole. Whereas the larger fishes, we have to remove the fin, skin, and so many other parts of the fish. So in that sense, the processed or dried and salted cured fish are a lot more advantageous, particularly if you have to look it from a nutrition security perspective, reaching to the hinterlands.
Thank you so much, sir. We are totally running out of time. I wish we could have more interactions, but we have time constraints. So thank you so much on behalf of Equinox 2022 Organizing Committee, Maitri College, University of Delhi. I heartily thank you for enlightening us and taking up the questions. Please, everyone, please stay connected. Professor Anindya, he has joined, so we'll be starting the next session very soon.
Thank you so much.
I request all the participants to remain connected, because our next speaker has already been waiting for us. We are running a bit late. We apologize for that. And I would now request Dr. Looney from the Zoology Department to please take over. Welcome to Maitri, sir.
Yes, thank you very much. It's very nice being here. And thank you very much for this invitation. It's a pleasure to address you.
Good afternoon, everyone. Our next talk is with Professor Anindya Sinha. It's my honor to introduce India's one of the primatologists, Professor Anindya Sinha, from the National Institute of Advanced Studies, Bangalore. Sir did his doctorate in molecular biology from the Tata Institute of Fundamental Research in Mumbai, and has earlier worked on the biochemical genetics of yeast, the social biology of wasps, and the classical genetics of human disease at the Center for Ecological Science in the Indian Institute of Science and the National Center for Biological Science, Bangalore. Dr. Sinha's principal research area over the last 3 decades has, however, been on the behavioral ecology, cognitive ethology, population and behavioral genetics, evolutionary biology, and conservative studies of primates and other non-human species. His current research thrust is in natural philosophies, animal studies, art heritage, and performance studies involve ethnographic exploration of human, non-human relation, and the lived experiences of non-human or human, promising unique insight into more than human life worlds of the past, today, and in the future. Lastly, Professor Anindya is deeply interested in the popularization of biology and involved in establishing a master degree program in wildlife biology and conservation in Bangalore 2001. He is also working closely with the International Biology Olympiad for over 2 decades and has lectured extensively in a variety of educational and research institutions, both across and outside the country. Welcome you, sir. Over to you, Professor Sinha.
Thank you very much, Dr. Looney, for that very kind introduction. Since we are clearly running out of time, let me directly go into the talk. Can everybody see my screen? Is it visible? Yeah?
Yes, sir, it's visible.
Okay, wonderful. So non-human life has traditionally coexisted rather peacefully with human communities across the Indian subcontinent. The two primary underlying reasons for this is the spirituality that is believed to be shared between many life forms that we coexist with, as well as with human beings, and the exalted positions that many life forms have held in the religious beliefs of our country. Now, the spirit of coexistence, however, appears to have been under threat in recent times, not only with the drastic reduction and fragmentation of our natural environments, but also the growing competition between humans and non-humans for shared resources across a variety of shared landscapes, both natural and anthropogenic. Let us now, in this discussion, however, principally turn to our cities. Although I will occasionally return to my beloved Bandipur National Park, the deciduous forests of Karnataka, where I began to study the synerbization of macaques, which is a kind of a primate species that I will be talking about later. Now, these macaques figuratively and literally began to move away from their natural deciduous forests where they were born into the highway that ran across these typical forests, these deciduous forests. And from there, they moved to human habitations and into agricultural fields near the periphery of the forest. And the macaques, therefore, have come to town. Urbanization is in fact at the forefront of the challenges that India and several other nations of the global south confront in the 21st century, with urban poverty being on the rise and rapid urbanization seriously outstripping most cities' capacities to provide food, shelter, and adequate infrastructure for their teeming millions. In this connection, a neglected dimension of urban governance concerns non-human mammalian and bird life in our Indian cities. New Delhi, for instance, and I will quickly go through these slides, which basically talks about how urban ecologies have exploded across the world and how it's important for us to now pay attention to these. Let me turn to Delhi, the city that you're all in right now. New Delhi has about 12,000 stray cattle, 400,000 feral dogs, and 9,000 wild monkeys, a situation that is similar across many Indian cities today. Cattle provide opportunities for the poor to deal with urban precarity, but come into contestations over access to the city. Stray dogs and monkeys generate conflict by disrupting everyday life and posing significant health risks. Although this is a major contemporary governance challenge, adequate frameworks to understand human-animal relations and design effective policies to manage potential conflicts between humans and non-humans are seriously lacking in urban India. Through my own ongoing work on urbanization processes being experienced by non-human species, including the bonnet macaque of South India, which you see in this picture, and Asian elephants. We hope to understand what living in rapidly urbanizing environments might mean to non-human individuals and populations themselves, and reflect on the opportunities that geographical explorations may offer for our own understanding of urban ecologies of the future, especially across the cities of the global south. Urbanization is a process that transforms nature into novel nature-society hybrids. And nowhere is this better exemplified than by the ubiquitous urban macaques that live integrally in virtually every city and every town of the Indian subcontinent. Too sentient to be animal, yet too other to be human, too sacred to be culled or killed, yet too rambunctious to be accommodated in our backyards, provisioned for by people, relegated to the background by the state. India's urban macaques are commensal creatures par excellence. They cohabit comfortably with people, but also unsettle the rhythms of the everyday and pose serious public health and governance concerns. I'm sure all of you know about the adaptability of the rhesus macaque that you see in Delhi, or those of you who live in other cities of North India know, right? Rhesus macaques and humans are messmates, company who eat at the same table. And this lies at the heart of commensality. Food becomes a point where mutual interests of macaques and people overlap, a convergence that is simultaneously material, semiotic, and affective, reconfiguring macaque ethologies, reconstituting their urban lives. Macaques are extremely adaptable individuals, as I mentioned, and our fieldwork too suggests that they're able to actually change their foraging strategies to access human origin foods, as well as to devise very, very smart methods to exploit human artifacts and objects for their survival, as you see in the slide. Let me, however, now briefly take you to the Bandipur National Park, where the processes of synerbization or urbanization of wild bonnet macaques, this is the other species that we've been working with in South India, have begun with the interactions between the macaques, the visiting tourists who regularly interact with and feed the monkeys, and the fruit sellers whose livelihoods have now come to depend on the human-macaque interactions. Raghavendra, an elderly banana seller, offers his fruits to the visiting tourists at the Bandipur forest camp, largely to benefit the macaques who eagerly wait, their arms outstretched, for the humans to be throwing their food at them. It is also not uncommon for some daring individual macaques to try and grab a banana or two under the watchful eyes of Raghavendra, only to be deterred when he half-heartedly waves a long, thick stick at them. Not once, however, has he struck them. Let me tell you the story of Small, the name of a dominant male, adult male, in Camp 2, a troop that I have been studying for 20 years now. And Small has developed an extremely clever strategy and a very deep relationship with Raghavendra. He comes and sits quietly next to the banana vendor, almost in contact, but not once looking at him or at the desired bananas. No vocal or gestural signal is exchanged between them. Raghavendra picks up a banana and offers it to Small, but does not look at him. Small takes the bananas gently and moves away, once again, not acknowledging this donation through any kind of visual or haptic gesture. He returns to Raghavendra a few hours later, and this mutually accepted interactive relationship manifests once again and again and again until evening descends on the forest camp. Interspecies behavioral exchanges, such as that between Raghavendra and Small, can often lead to the development of extremely personal relationships between individual macaques and humans, the generation of more than human affective and immersive environments, but also in turn to the slow but steady synerbization or urbanization of macaque worlds. My colleagues and I have extensively tracked individual bonnet and rhesus macaques that have now begun to move out of their natural forested habitats to dwell permanently in close proximity to humans, setting into motion processes of gradual habituation and the development of warm, affective, emotional relationships marked by both tolerance and friction between individuals of both species. Let me thus return to the city again. Provisioning by humans of these macaques has corporeal bearings upon urban macaques, impacts on their bodies, their physiology, their health. Certain rhesus macaque populations in Delhi, for example, have developed a great fondness for junk food, packaged chips, ice creams, aerated drinks, and fried savories. Provided for by people or obtained by snatching, our observations suggest that processed food continues as much as 90% of rhesus macaque diets in some parts of the city, especially when natural forage is scarce. So 90% of the macaques' food in Delhi for some individuals, some groups, consists of entirely human origin junk food. Urban macaques have also been reported to develop obesity, diabetes, and occasionally have higher levels of cholesterol than do their rural counterparts, conditions generally associated with urban human lifestyles. Readily available anthropogenic foods have also contributed to the recent surge in urban macaque populations across cities. In Delhi, commensality seems to have become a metropolitan concern in at least 4 arenas. First, everyday practices, including provisioning by humans, contribute to both the flourishing of these monkey populations and the frictions that result from their urban presence. Yet, the everyday is not about conflict alone. A troop of rhesus macaques descends from the high rises of Connaught Place in central Delhi. Sliding down pipes, the adept movement becomes a series of silhouettes over shops selling sacred threads and bangles before turning into an undulation as the monkeys clamber across electric wires, casting shadows on astrologers and palmists, reading the fortunes of people many feet below. This vertical descent comes to a slow halt as the animals reach the tiled plaza in front of Delhi's iconic Hanuman temple, thronging with refugees on a Tuesday or a Saturday evening. These are people who have come to offer prayers and alms to the needy. With a sure extension of its forearm, a macaque reaches out for a banana offered by Anuj, a devotee. A transaction and a trans-species action takes place. Food for the monkey and the harnessing of punya, a diffuse cleansing merit for the man. I come here every Tuesday to feed the monkeys, Anuj says, repeating the action until his dozen bananas are gone. From a lower middle-class rural family in northern India, Anuj had come to Delhi over a decade ago in search of employment, but none of his appointments ever worked out. Unemployed, alone in the city, Anuj started going into clinical depression. Anuj began to lose hope, wishing to end his life. Many times I thought of wanting to stab myself, he tells me. I became skeptical, even angry with God for my predicament. Out of sheer desperation, Anuj enrolled into IT classes and began fasting every Tuesday when he would visit Connaught Place's Hanuman temple to participate in rituals and feed the macaques. This routine, this interaction with the monkeys made me experience a deep transformation, Anuj said. His mental health gradually improved, and he even managed to secure a position in a multinational company. All credit goes to these monkeys, remarks Anuj as he hands out his last fruit to an outstretched hand. These visits to the Hanuman temple have renewed my faith in life. This becoming urban of macaques has been fostered by everyday practices of commensality. Delhi witnesses large-scale feeding of macaques from passerbys pausing to buy bananas from street vendors to the affluent middle class who bring food in cars, strewing large quantities of gram, vegetables, and fruits by the pavement thronged by macaques. These are largely the actions of devotees wishing to receive merit or punya, or, as in the case of Anuj, small sets of making sense of misfortune and keeping distress at bay. Provisioning and the sentient encounters between people and macaques have, in fact, also led to the emergence of what one might call affective economies. These are economic arrangements that are contingent upon commensality and the body attunements that cross human-monkey divides. A number of banana vendors in Delhi today earn a living by selling bananas to devotees who in turn buy them, often only to feed macaques. Some of these vendors occasionally toss bananas to the macaques to keep them around in their vicinity and thereby attract customers. One vendor even told me that he regularly fills water in a well near his makeshift stall to ensure that the macaques are invariably present in the area. Here, the ultimate consumers of commodities, bananas, are the macaques. Their presence is vital for the economic transactions to take grip and for value to be realized, and therefore vendors actively cultivate relations with these sentient creatures. Human macaque encounters thus subtend economic activity and give a new meaning to what constitutes the economic in the urban sphere. Second, the rhesus macaque has become a concern for the state and its bureaucratic apparatus. Regulating street vendors and curbing stray dogs on macaque populations have been majoritarian strategies adopted to develop a Delhi of the future envisioned as a, quote, a modern, clean, and globalized capital, unquote. There is, however, significant political debate on these terms, commensal, wild, which has in fact been mobilized for a range of political and bureaucratic ends. The Delhi Municipal Corporation, for example, argues that macaques are not stray animals, but wildlife. The management of their populations and habitat the civic body maintains is thus the responsibility of the state's forest department. In response, the forest department states that urban macaques have become commensal in nature by having evolved, by adapting themselves to live close to human habitations. They can no longer be considered wild. The onus of regulating urban macaque populations, they contend, is then on the Delhi civic administration. Commensality and wildness thus become points of contention, sparking a politics of urban governance to the face of macaques overtaking human action and rendering majoritarian logics futile. What is pragmatically more important to note, however, is that after decades of intervention, the menace, the so-called menace, is escalating. Capture and relocation have been plagued by chronic bureaucracy, but more importantly, subverted by the behaviors and the actions of the macaques themselves. New troops have moved into territories evacuated by captured macaques. They have learned to avoid traps, rendering attempts at creating an animal-free global capital frustratingly futile. Third, commensality becomes a concern through public health. Anthropogenic food landscapes with their concomitant human interactions severely enhances intra-troop aggression amongst the macaques, with individual animals competing strongly for attractive human provisioned foods. They also begin to show agonistic behavior towards people. Every year, over 1,000 monkey bites are reported across Delhi. such agonistic behavior towards people typically being contingent on the extent of provisioning, the nature of the foods provided, and the patterns of their distribution. Provisioning makes individual macaques less fearful. They are now brave, emboldened. The relatively dominant individuals start engaging in aggressive interactions with people, often inflicting severe bites, especially on those more vulnerable, especially again, women and children. At least 5 cases of monkey bites are registered in Delhi each day, posing risks in the form of zoonotic pathogen transfer. Macaques can also harbor several other pathogens, including those responsible for herpes B and for tuberculosis. Fourth, and finally, Delhi's urban macaques get entangled in debates on animal welfare. Welfare activists contend that policies of rendering Delhi macaques free have been short-sighted and heartless. Several complaints have been lodged and filed against civic administration officials and contractors to whom macaque capture has been outsourced for the poor treatment of animals, the injuries caused to them, and for violating the Prevention of Cruelty to the Animals Act of 1960. Attachments and obligations of animal welfare activists and certain members of the public, for that matter, thus often rub against those of the state. These ecologies of concern, as we call them, operate strongly across different domains, but they usually terminate in the politics of majoritarian state interventions, which attempt to regulate macaque presence, their lives, and reduce human-macaque conflict in urban areas. In many Indian cities, for example, there have been widespread moves to translocate and rehabilitate rhesus macaques from the urban polis to rural commons, a strategy that has been at the center of state response to the urban monkey menace. However, much of this at least shifts the problem around, rather than coming up with a durable solution, as exemplified by the famous or infamous Asola Bhatti sanctuary on the outskirts of Delhi. We argue, and this is important to note, we argue that such resolve in relocation is reflective of perhaps a wider trend in India, where problem urban macaques are translocated down the chain of the Indian socio-political hierarchy, with troops caught in prime urban centers being released in the suburbs, and then they are caught from there, and further trapping and relocation takes place to rural and forested areas. It's just the human social political hierarchy that seems to be operating. Whoever has a louder voice is able to move the macaques around. Those who don't have a voice have to suffer them. And there is nothing that can be said about the macaques themselves, whose lives are completely in jeopardy. Remember, they were here before we came here. It's also extremely important to remember that macaques could be very much affected by their encounters with the people as well. I will therefore like to end this talk with an account of a very unexpected change in macaque-human relationships, which has recently occurred in the cyanobizing forests of Bandipur National Park in Karnataka, in southern India. Individual macaques in one particular troop in the Bandipur forest camp have begun to use a novel food requesting behavioral strategy, a combination of a soft coo call with an arm outstretched to directly request food from tourists visiting the sanctuary. This multimodal communicative strategy, which usually results in food being thrown at the macaque, was never shown towards members of their own species, possibly because food is never shared between the macaques themselves. Juvenile bonnet macaques who have begun to forage independently typically display this novel communicative behavior, as they are obviously unable to practice the more aggressive food acquisition strategies of the adult macaques, given their overall small size and their fear of humans. Let me see if I can show you a very brief video of how this call is. You will notice a coo call and a begging gesture. Yes. So So you may have noticed how the macaque kept giving this call, and whenever somebody looked at her, she put up a hand, right? Even while she was being chased away. This uniquely soft coo call, now being used by female and juvenile macaques in several populations in different but related contexts, possibly serves to attract the visual attention of their human subjects during these interactions, or as a signal to express their intent to acquire food held by the humans. Right? The hand extension gesture, in contrast, appears to be produced only when the macaque is able to lock gaze, the eyes meet with their human benefactor. What makes this communication system unique is that all the component gestures are performed intentionally and with the hand extension gesture, possibly even referentially. These are gestures that are produced by conscious will. And when we say referential, the hand gesture is possibly pointing to the food that the macaque wants. This may sound trivial for humans, but believe me, to be able to establish this for non-human species like the macaques is a remarkable step in understanding how complex their cognitive abilities are. This request, which the macaque now puts out, clearly demonstrates the simple but very powerful intention of a young, hungry macaque to obtain a morsel of food, and this becomes reinforced and ritualized when positively responded to by human beings. It is, after all, emotionally wrenching not to respond to this unusually human appeal where a hand comes out for the food that you're holding. This successful behavioral strategy, possibly initiated by one or a few adventurous and innovative individuals, have now spread rapidly by processes of social learning across the troops of the Bandipur forest camp. Not documented anywhere else amongst any species of wild monkeys in the world, this particular kind of gestural and material exchange between human and non-human primates suggests that bonnet macaques may be unparalleled in their social flexibility and adaptability that allows them to survive the most hostile of environments. Certain individual macaques may thus even be capable of developing, refining, and learning a fairly complex communicative strategy that allows them to negotiate with potential adversaries, a human, a strategy that can be used directly, though possibly unreflectively. They may not be thinking about this at will, but they use it at will, well within their lifetimes. They learn, they practice, and they use this behavior intentionally to request food. Let me then finally leave you by asking you to think about the nature of these various kinds of affective interactions that I have just spoken about. Some of these relationships have emerged within the city, but some at specially urbanizing once forested locations, natural cultural contact zones, where humans and non-humans have begun to encounter and relate to one another through specific exchanges of signals and materials. The gradually synerbizing forests of Bandipur have thus become a fertile and heterogeneous space where relationships between two phylogenetically related species are being improvised and ritualized within very unequal relations of power. We can also visualize how the possible emotionality of the individual actors engaged in this relational practice is leading to the co-creation of new forms of subjectivity within these changing spaces of interaction, a feature that we will possibly see increasingly with other species of non-humans as well in the Anthropocene. The traditional, the intimate and persistent presence of non-human primates and other species in our lives over centuries must then lead to the reimagination of our societies and not being exclusively human spaces, but nature-society hybrids co-constituted through relations between people and animals. there nevertheless continues to be very little engagement with the growing synerbization of our wildlife populations, whereby various urbanizing influences, primarily human presence, activities, and artifacts, have forced individual animals to adopt to these new altered socio-ecological environments for their very survival. How then do other sentient creatures negotiate and learn to inhabit complex dynamic environments, comprehending them according to their own knowledges, their own speeds, their rhythms? What bearings do our lives and our often unthinking, unfeeling actions have on the life worlds of animals? And how can a comprehension of these shared life worlds contribute to a recasting of our own perspectives, prejudices, and practices? Does the fervent appeal for food with arms outstretched then embody the macaque's last, desperate, effectual bid to cope with the loss of their habitats and resources to a far more powerful species, humans, a final act of negotiation with a world that is quietly slipping away from their grasp? Thank you.
Looney, you are not audible. Please
Yeah,
unmute
Looney, please
yourself.
unmute yourself.
Thank you, sir, for this enriching session. Very wisely, you explained one of the major concern, that is non-human life, which is actually poorly noticed by us as well as by the government. You made us to understand human or non-human relations and to think to design effective policies to manage this in urban India. Thank you, sir. Now the session is open for the questions.
You can raise your hands to ask questions to sir.
I'm sure many of you have interacted with these monkeys, right? Wherever you live. It's actually quite fascinating that I don't think anywhere in the world do we have cities, towns, villages, entirely inhabited by not only non-human primates, but a whole range of other species with whom we've enjoyed very positive relationships for very long periods of time. And today, these positive relationships often take a fairly negative turn. And the important question is, how do we then think about the future? How do we plan to incorporate them into our lives? How do we plan to develop cities that will also take care of the non-humans, right? We cannot be like Singapore, which tries to kill every pigeon, every parakeet, and they have failed, right? It doesn't work that way. It's not in the Indian psyche to be able to wantonly kill other species. We have to learn to coexist with them. That was basically the goal of where I want each of you to start thinking about how do we coexist with other species.
I think, Looney, can you pick
Yes.
up the question by Jyoti?
Yes,
You can
Jyoti.
unmute yourself. Rana, Jyoti or Rana, anybody?
Yeah, I have already unmuted. Now my question is, sir, I had an opportunity to see a monkey. Basically, somebody got the monkey, and the monkey was, it was tamed by someone, and he got released somehow. I don't know. But we were doing research. We used to keep that monkey in in the lab where we were doing the research, and we just had put the string on the monkey. And one day we just gave a mirror. The title totally fits monkey in the mirror. He used to see. And one day we also gave one lipstick. So he used to put the lipstick. When we used to do like this in front of monkey, he used to do the same. So we named the monkey Shahnaz Hussain. So it was very interesting experience with the monkeys. And sometimes he used to sit on the senior lab attendants and he used to, pat the head. He was very like feeling like somebody very well known to you.
Right.
It was really a very interactive session and very nice, informative, talk you had given.
Thank you. Thank you very much. So I think what became very clear to you, if I may just respond, what became very clear to you is obviously the fact that they are very complex beings, right? The kind of interactions that you had, the responses that the monkey provided, clearly tells you that it is a cognitively complex individual. And therefore, we need to treat all such beings with a very different kind of an attitude than we often take. Of course, in passing, I must also mention that a lone monkey kept in isolation like this is a very, I may use the term, a very unhappy monkey. It's very unhappy. There can be frustrations because it's a social being. You can just imagine how it would be for a human being to be kept in an environment where others are watching it, laughing at it. You know, it can be very stressful, and it's true for the macaques as well. And therefore, one thing that we must be very careful about is not to keep individuals firstly in captivity or in isolation, because they are evolved to be social beings. And therefore, we need to be much more cautious about it. And also the fact that, you know, we have to be perhaps try ways in which we can let them go back. Feeding is something, and I'm sure some of you may ask this, feeding is something that is banned by the government. We still do it. And as my talk told you, people have a very good reason that they argue for, which is that they feel that the monkey needs food, they are doing good for the monkey. In the process, they have a good feeling. It may be religious, it may be spiritual, it may be just functional, but feeding of wild animals, such as macaques, is strictly not to be encouraged. However much we might feel that we are doing them a service, we are really not. Because by feeding them, they lose their fear of humans. There's a lot of conflict, and ultimately we remove them, right? We put them down, we throw them out. And that gets triggered because we started feeding them in the first place. So I think we need to be a little more sensitive and, think a little more deeply before we start interacting with these.
Yeah, but sir, it has become a usual practice in Delhi University campus that there are lots of monkeys and people come in, and even once I was going through that lane and somebody told me कि आज खाया नहीं आप केले खरीद लीजिए and just give it to monkeys.
But you should never do that. They are
but
very,
I
very
have
small.
to do that because I said मैं अपने हाथ से नहीं खिला सकती because I'm scared of. You can do that because he said कि बारिश हो रही आज कोई आया नहीं.
नहीं, next time, let me tell you, they are generalists. They have a huge source of food, natural food. I've studied them in the Delhi Ridge, and they have a large number of plant species that they feed from. This is attractive for them, of course, but this is something that henceforth you should never encourage. You should prevent other people from doing it. And, it's really not something that we should encourage at all, believe me. No monkey will die from starvation if you don't feed it.
Now we can take another question from Jyoti Jha. Yes, Jyoti, you can unmute yourself.
Ma'am, am I audible?
Yes, you are.
A very good afternoon, sir. I am Jyoti Jha from Zoology Department, third year. Sir, it was a very interesting interactive session. Like it was a topic of a coexisted, like the other animals like street dogs, monkeys, cows. So my question is like, there were temples in a Delhi or any other region of India or any other parts of the country and all. We thought that we like it a spiritual thought about the monkeys, like we dedicated it as a Hanuman and all.
Right.
And on the other hand, on extreme, actually, the cases in a newspaper that the monkeys were a poison or a brutally killed by the people. So it's in this contrary, I like these are two human behaviors.
Absolutely. Yes.
So please light up the point.
Yeah, so the thing is, like any other relationship, it's a complex relationship, right? Now, let's say, you're a young individual, you have friends, you have your parents, you have your siblings, and every relationship is unique. Every relationship is complex, right? You can lose your temper with those you're close to, but also be extremely affectionate. And I think the same the same kind of feelings, the same kind of emotionalities drive our relations with non-humans as well. Firstly, of course, it depends also on the kind of an individual you are, right? It could be your temperament, it could be your upbringing, it could be your own religion, your feelings of spirituality, your cultural entrainment, all of which will predispose you to interacting with non-humans in particular ways. It could also be your past experience, right? Which informs you and tells you, yes, I better not approach a monkey, or I will kill a cockroach, or whatever, or will I feed a bird or not, right? So all of these are shades, not only across populations, but across human individuals. And therefore, as I mentioned right at the beginning of the talk, the reason why Indians are very unusual is that we never, and this is very unlike the West, in India, people always look at non-human beings as being in a continuum with us, right? Jainism, Buddhism, various Hindu traditions have also considered non-humans and humans as being on one scale. We have different abilities, we have different capacities, but nevertheless, we are all fellow beings. This is very Darwinian in some sense, very unlike the Western Judeo-Christian religious thinking, or even the thinking of great philosophers like Descartes, who has influenced Western science so much. According to them, humans are superior to all non-humans. And if there is any conflict, that is the end of the non-human. They will be put down, no questions asked. Never does that happen in India. However much there may be a tiger in a zoo which kills a human being, possibly because of the human's actions which are not appropriate, or if an elephant kills a human being even in the forest, these animals are never put down. They are never killed. We may isolate them from people. We may keep them under different conditions, but never do we judge them that they should be removed just because they have killed a human being. So I think this spirit of tolerance, this spirituality that governs human, non-human relations in India is remarkable. It's unique, and it's going to be essential for us as we plan our conservation in the future. It's so much easier to develop conservation strategies in India than in the West, simply because, you know, I have seen an old woman whose house has been destroyed by elephants weeping, but saying, they are also God's creatures. Don't kill them. Just make sure they don't destroy my house, but let them also remain. Let them also feed. Where else will you see this kind of tolerance, this kind of understanding? And we need to understand and move forward with that empathy. But that doesn't necessarily mean that we have to feed them or worship them as God. That's one end, as you point out very rightly, Jyoti. But at the other end, so I've seen in Bandipur people with a stick and holding a piece of bread. If the monkey takes the bread, you're fine. But if it comes too close, you wave the stick. Is that logical behavior? Is that common sense of any kind? But yet we practice it, we do it. I think we need to be more sensible than that. Sorry, that was a very long answer to your question.
No, sir, it was absolutely right. Thank you so much, sir.
Thank you. Thank you. Very, very nice. Very nice of you. Thanks.
Thank you, sir, once again for this fruitful talk.
Thank you.
And a very interesting talk. I mean, there's so many people who want to ask, but I think we'll have to restrict ourselves.
No, no problem. My email is available everywhere, yes. I think. So please feel free to write. Please feel free to ask me questions, even if we don't have time. I know time is short and we are running behind schedule. But thank you, everyone, for your interest and for your questions and your thoughts. And I think going ahead, if you start thinking every time you see a non-human, it could be a cockroach, as I said, it could be a monkey, it could be another human being. We are all in a continuum. Let's think about how we interact with them. How do we make their lives as comfortable as ours? We have to. We don't have a choice. Thank you.
Now I am going to hand over the session to Dr. Aditi.
A very good afternoon to all of you. We shall move ahead with the next thread of our Equinox 2022, the international conference which we are having. And the theme for this Equinox 2022 is expanding frontiers of knowledge. And we are honored to have with us Dr. Aarti, who is the head of the department and associate professor in the postgraduate course of landscape architecture at School of Planning and Architecture, New Delhi, an institute of national importance. She possesses a multidimensional experience of 20 years in academics, profession, and research. She is currently an expert member in many organizations, some important ones being Central Zoological Authority, the national organization which regulates and manages all the zoos in the country, National Zoological Park, Public Works Department, Irrigation and Flood Control Department, Jal Board in Government of Delhi. As an advisor to ENY, she has been instrumental in developing vision plan for 10 selected zoos in the country. As a professional consultant, she has worked on projects of various natures and scales related to ecology, environment, landscape, architecture, habitat design, and architecture in various capacity. She has also served as a landscape consultant for the most prestigious estate, the Rashtrapati Bhavan, New Delhi. Dr. Grover has lectured enormously on various important platforms like training program for zoo officials, and has been a resource person for many training and capacity building programs and skill development programs in the country, including GSDP workshops, Zootopia 2021, organized by CZA and Atal Innovation Mission, Niti Aayog. The title for her talk today is Paradigms of Man-Nature Association and Ecological Perspective. Ma'am, we welcome you on the behalf of Maitri College.
Thank you. Thank you so much, Aditi. I'll just share my screen. Is my screen visible?
Yes, ma'am, absolutely.
Thank you, Aditi, for such a nice introduction to me. And I'll get going because my talk might just get a little longer. I will start by thanking the organizers, and I'll get going. 13.7 billion years ago, an extremely enigmatic phenomena happened, and we all know it as the Big Bang. On a 4.5 billion years old planet, man is one of the recent additions to its vast biodiversity. Nature's own, but the only creation which has become the biggest threat to her today. And as some researchers have said, virtually a global super predator of the times. The next 30 minutes shall take you through a journey of human progression, attempting to highlight the underpinning philosophies that governed this man-nature association during its various stages. We shall understand how during each phase, these systems of ideas have influenced human actions, which in turn have resulted in visible and categorical impacts on ecological processes, and on the other hand, the ever-expanding development in the form of built environment, like cities, industries, and other settlement of sorts. The three parallel fronts shall be looked at simultaneously: the philosophical agenda, the expanding physical environment, and the ecological degradation. These knowledge systems have indeed been the foundation of the type of life that each of these eras witnessed. The talk shall highlight the key questions that stood tall in front of these societies and how their choice of answer shaped their fate. Just like those times, there are a set of very serious and critical questions that we too as a community are faced today with. The questions of human existence and the questions of human sustenance, to which answers shall have to be provided by the human community today. The choice of these answers shall only determine the possibility, whether or not, and quality, what kind of future human civilization shall exist. The world has been in a state of flux since the height of the last glacial maximum of Pleistocene. The post-glacial climate is sometimes said to be unusually unstable, but there have been notable fluctuations, a widespread optimum in the Holocene, sudden descents into the cold phases, and long periods of intense drought. Recurrent phenomena like El Nino and La Nina variations in Pacific sea temperatures have experienced measurable fluctuations in frequency and intensity. Yet most of these second order changes have not been uniform across the planet. And because of this reason, we also see there has been a continuous response by the living organisms. The population of some have grown, some have fallen, and some have changed their distributions over the ages. There are known to be 5 great extinctions till now, and as the research suggests, that we are heading towards the 6th mass extinction at a very, very fast pace today. The growth in the human numbers and the changes in economy over a period of last 1,000 years have increased the environmental issues, including the quantities of gases emitted to the atmosphere. And we are more than aware of this already. But a very important point to ponder upon is that these curves not only highlight environmental issues, also symbolize the cultural attitudes in which the growth in wealth and throughput of resources are regarded as normal, but the efforts are made to sustain these curves rather than leveling them out. This is the real irony of today. The earliest human societies thrived on an abundant supply of water and a meager population to stake claim on it. This was the hunting-gathering period in human evolution. In the context of changes in the attitude of the humans, and hence change in the human and nature association with the passage of time, E.A. Gutkind identified this association as I, thou, characterized by the fear of unpredictable forces of nature with an accompanying desire for security. Man chose to remain in sync with the larger forces of nature owing to the fear, of course, of the unknown, but also the limited capacity and wisdom that he acquired until then. From the climax of this instinctive man, as he may be called, is experienced in the cave arts of France and Spain. Parallelly, India has some examples like Bhimbetka and Kurnool caves, which belong to the Paleolithic era. From a population that was 100% hunter-gatherer and based on food collection from the wild, agriculture became dominant in about 8,000 after about 8,000 BC. The discovery of metallurgy now enriched the arts of war. Transporting metals to agricultural sites resulted in diffusion of ideas, and the other thing that started was trade with barter system. Farming was a brilliant discovery of mankind. It developed around the banks of the rivers, and we all know these rivers were Tigris, Euphrates, Amazon, Nile, Indus Valley, and all these places. And this was the start of the city life. The great civilizations of Mesopotamia, Egypt, and Indus Valley civilizations are all about this time. But this entailed a cost. Agriculture required open space with ample sunlight, and for this, forests were burned down and cleared for plantation. The original diversity in a piece of land made way to the fewer species suitable for human consumption. Over the next few hundred years, agriculture flourished with ingenious methods of irrigation. Rivers were diverted to canals to feed farms. This started to change even the riparian zones of rivers. So very soon, farming that had emerged as a brilliant discovery of humankind started being recognized as an agency of change at the ecosystem level. This was the first time that we had started to witness any change in the ecology that existed originally. And hence, the ecologists label agriculture as the first instance of large-scale assault on the environment. On the philosophical front, this is the age that also saw the origin of several great systems of thought and rules of behavior of humankind. The term axial age is often used to refer to the early part of it because many of these systems, which so deeply formed and changed humanity's worldviews, appeared during this time only, in the last few centuries BC to the first few centuries AD. So this is a very, very important time regarding this matter. These worldviews can be placed in 3 broad categories. The first one was the traditional evolving systems that included earlier ideas along with the new ones. This group evolved within the context of the traditional views. In India, for example, beginning with the Vedas, people worshipped gods, including many of who personified the striking phenomena of nature, such as Indra, the sky god, and Surya, the sun, with hymns and sacrifices. The early garden forms of Japan were heavily influenced by religious beliefs and symbolism too. Meditation was the garden's chief purpose, through which the meaning and purpose of life was revealed. The later Zen gardens, the Zen dry gardens, is a perfect reflection of a monk's life, imbued with simplicity and austerity, leading to spiritual enlightenment. The second group of world systems originating in the ancient world, which taught the oneness of life and ethic based on respect for all living beings, and therefore seems to have encouraged the preservation of nature. These religious philosophies, as many of us would relate to, had great reformers such as Mahavir in Jainism and Siddhartha Gautam in Buddhism and Lao Tzu in Taoism as their exponents. This was the second worldview. A third group of worldviews that arose before the end of the ancient world and are the monotheistic faiths, which agreed that there is only one God, created the universe, including the earth and all the creatures within it. And among the God's creations are also the humans, to whom God gave dominion over the earth and all its other creatures. Human dominion over earth and its non-human inhabitants must be exercised within the ultimate responsibility to the creator, that is the third world view. A glaring example of how this philosophy played a role in the decline of powerful empire is that of the Romans. Around 2 to 4th century AD, the Romans were extremely powerful. And we have read through the history how Romans actually built what they built. The lifestyle, the buildings, their processes were all high consumers of energy, indicating wealth and glory. So why did the Romans fail to maintain a sustainable balance with the Mediterranean ecosystem within which they lived? Among the answers to that question is the general Roman attitude towards the natural world. Among the many ecological problems suffered by the Roman Empire, most were caused by the Romans themselves. Deforestation and its consequence, erosion, leads the list of these disasters. B.D. Shaw, the perceptive historian, averred the tens of thousands of animals purposefully hunted down for the arena were, of course, a small proportion of the total that yielded to more mundane processes such as the systematic destruction of their habitat by the expansion of agricultural settlements. This was the quote that he said. With each species that is extirpated, the closer the ecosystem verges upon collapse. So by hunting and capturing animals for slaughter in the arena, the Romans were weakening their economies in the long run. They were unaware of this and they thought that by killing those animals who were actually hurting their herds, they were doing a good thing. But actually, these predators ate a far greater number of rodents and the other animals that devoured their crops. An increase in number of the latter reduced agricultural production, and this finally led to the large Roman collapse. What happened? It was just an alteration in a small food chain. Here, the underpinning doctrine of I-it may be visible where nature was treated more like a commodity and an object of use. This attitude led to an insensitive way of looking at the environment and ecology, leading to the exploitation and a consequent death. So just after this, Europe slipped into what is known as the Dark Ages. The idea of landscape and design of open spaces and gardens was completely changing meaning with time. For example, in the medieval European cities, inward-looking cloister gardens that you see on the screen at this point of time became prevalent, where fruit cultivation and flowers were grown. But the more important was herbs. Dark Age is actually the period which saw the least in terms of art and architecture. You know why this time was called Dark Ages, and some of us have read about it, because cities in medieval ages shrank within walls, and palace, church, and the marketplace became important. The landscape was a privilege only for the rich and royalty. Disease, religious fanaticism, crusades were all over seen. Indian medieval cities also showed a similar morphology and ethic. Ecologically, from 5th to the 10th century, the earth was, as a whole, however, still full of life in many thriving ecosystems. Parts of the continent were still covered with forests. Thus, the land available for agriculture was limited. Europe was undergoing major changes of climatic spell in this period. By 11th century, Europe entered a warm phase, and that had a profound effect on agriculture. Environmental historians have noted that there was a significant receding of forest line in major parts of the continent. Built-up areas were spreading, and with them, clearance, erosion, and advancing desert was also visible. Elsewhere, the rate at which humans were altering the face of the earth was slow but accelerating. It was not proceeding at a steady pace, but it was faster than it had ever been earlier. Certain societies were learning new skills, and these skills were to be used in future times for more efficient humankind. Preparations for rapid modern changes were actually made in these Middle Ages. Parallelly, another thing which was happening was feudalism. Feudalism was an established way of life in large parts of Europe at that point of time, and the height of which gave rise to, some of us may know, the enclosure movement, finally, which led to a very big incident that we all know as Industrial Revolution. This was also the time when Europe witnessed mercantilism as the major political and economic movement. The next shift resulted from the formation of the first global economy after Europeans arrived in America in 1492. This was the onset of mercantile capitalism, marked by the Great Columbian Exchange, which was the widespread transfer of plants, animals, precious metals, commodities, culture, human populations, technology, and above all, diseases, and of course, ideas between the New World and the Old World. This age in history is mentioned as the age of discovery. In terms of landscape, now the medieval city was drastically opening up to physically embrace the norms of Renaissance. The moats were removed, and the city witnessed emergence of large-scale piazzas, plazas, and open spaces. The built and unbuilt demarcation was getting blurred as new architecture and landscape typologies were coming up. Examples like Great St. Peter's Piazza, the one you see on the screen, the revamp of many cities like Paris by Haussmann, new garden typologies like Grand Versailles, new forms of architecture, and vibrant and lively nature-capturing interiors were seen. For art, architecture, and landscape, this has been one of the most flourishing times in the human history. In India, at the same time, we come across a very significant landscape typology, the Islamic landscapes. During 16th and 17th century, there were two large variants, pleasure gardens and tomb gardens. This is Humayun's tomb located in Delhi. The most well-known example of tomb gardens that we see around is Taj Mahal, which is a quite recent of this typology. Later on, we see this garden overlaid on hilly terrains of Kashmir and taking another form based out of context and topography of the place, and were called the Paradise Gardens. Ecologically, the native forests were once again being altered to create the fruit gardens and water regimes, altered to create the playful channels, fountains, chadars, etc. that you see in the picture right now. And that became one more example where the conceptual philosophy of a belief system dictated the landscape in a big way. The 18th century witnessed a new change in the context of man-environment agenda, which is the Industrial Revolution. This was the age of reason. The philosophical foundation for science was being laid and cut it finally from the revealed religion. It was in the UK and around that the Industrial Revolution began with its major impacts on human society and the community of life, including faster transport, urbanization, pollution, and scarring of the landscapes. The inventions that did the most to shape the modern age were those that allowed the application of new sources of power, especially fossil fuels, to the production process. So this was the time when we started to depend upon the fossil fuels. And this is a game changer, we all know. The European economy came to include, and in many ways to dominate, most of the rest of the world, the time of colonism, so that the world market economy came into existence. In this period, Europe drew raw material from the rest of the world and produced manufactured goods, which were sold not only at home, but also back to the countries which were the source of these raw materials in ecological terms again. This meant that Europe and other areas that came to become industrialized were using and degrading the material energy capital of ecosystems all around. The urban picture was evolving very, very fast. Before this, cities were small. There was a natural way that the inner city developed because the peri-urban setting would handle a few things. But now the labor started to stay close to the industries for obvious reasons, and the formation of something what we know as factory towns started to happen. These were actually the slums of that time. And that led to a very unhealthy way of living with disease and pandemics. So the glory of Renaissance that we just saw in 5 slides back was lost to the grim of the industrial cities. For the first time, new eras of research started to be discovered. Environmental thought in the early modern period began with observations by naturalists and scientists that human actions, particularly those of colonists, were making rapid changes around the world, many of them damaging to nature and threatening to continuing subsistence. These pioneer thinkers suggested programs of conservation, forest reserves, and restoration of deteriorated landscapes for the first time in the history. In the mid-19th century, we hear of Darwin, Haeckel, and other scientists developing the importance of the interaction among species and their environments in evolution, and began to conceptualize a science that is today called as ecology. This was an expression of modern rebirth of natural science. As an answer to the unhealthy living conditions in the time, urban planners like Sir Ebenezer Howard started finding models like Garden City movement, a utopian city which could house people in harmony with nature against those situations where factory towns were not giving such conditions. Another great contribution in the field of urban landscape was of Frederick Law Olmsted. The Central Park in the US was the first of this type, designed by F.L. Olmsted. You all know this picture, followed by many such open spaces which were available to people at large. This is seen as, again, a major shift where landscapes and gardens were now being viewed as public property, and the hold of royalty and church on these spaces got transferred to the common people, again, for the first time in the history. So this, again, is a shift that we see in the history. The solar-based agriculture economies persisted until after the mid-18th century somewhere, when the industrial economies then burgeoning in Europe and America began to have a strong impact upon them. Although such agriculture had persisted until even very recently, it can be argued that a fossil fuel-based industry was the world's major economy until about 1950, when it was intensified to a different level of interaction with the rest of the globe. All these changes, and each of them being labeled as a separate era, have been accompanied by a rise in the human population from a few million in 10,000 BC to over 6,000 million, or that is 6 billion in 2000 AD, and today we are somewhere close to 7.5. The main difference between the beginning and the end of the sequence has been a transition from a patchy and temporal impacts upon the energy and material flows of the ecosystems inhabited by the humans, which could still see some repair, to a partial obliteration of the natural world in a series of very large conurbations, together with a considerable degree of alteration of the terrain. Further, the effects wrought by carbon-based industrial activity upon the oceans and atmosphere have made Homo sapiens a species with a truly global reach, leading to the present high production consumer capitalist mode of living that emerged very lately. After 1950, as is believed by the researchers, is the dramatic, continuous, and roughly simultaneous surge in the growth rates across a large range of measures of human activity, technically termed as the Great Acceleration. I want you to bring your notice to the vertical line within each graph that you see at 1950. The changes in human production and consumption indicated by gross domestic product, direct forest investment, energy consumption, and telecommunications are reflected in the changes in the Earth's natural systems, climate, ocean acidification, terrestrial biosphere degradation, and fish capture. Please look at this graph very carefully, and you'll see on the left side, population, real GDP, primary energy use, urban population, large dams, water use, all these are increased a great deal after 1950. And on the same scale, the Earth system trends are also changing after 1950. You look at the emissions of carbon dioxide, nitrogen dioxide, surface temperature rise, all these are also increasing parallelly. So this is called the Great Acceleration. And ironically, both these parameters stand directly proportional, which actually poses a big question mark to the whole point of view of measuring economies through the lens of GDPs alone. In continuation to the earlier revelations of the naturalist and ecologist that we saw previously, another path-breaking research was given by Ian McHugh, which is called the McHughian ecological analysis method. He developed a multi-layered mapping technique to combine and analyze visually the complex data sets to effectively help designers take informed decisions about any new developments that had to happen on this earth. Nonetheless, we can't disagree enough that the world is in a phase of a messy chaos at the moment. Unnatural ways of viewing nature and human associations based on ecologically inappropriate drivers, we see such imagery in our cities all around. To provide habitat to exponentially and unrealistically growing numbers, development is encroaching not only land parcels everywhere, but also water and air. This is the new oceanic that we have come across, and a new type of city that it would be floating on water, and land is consumed. Now we have to move to the water. And this is a new typology of city that we see, the line, where they say that everything is going to be within this line in the huge desert. As a result, nature is expressing her anguish in terms of melting glaciers, disappearing water bodies, and life-snatching pandemics. We can all relate to this picture, but humans have now attained the highest levels of intelligence and capacity to improvise and design even for calamities. We design for calamities too. See what we have innovated during the pandemic. Yes, you get it right. Yes, you get it right. The way of life, the recreation, and energy consumption cannot suffer. But we, the wise Homo sapiens sapiens, have solution to every possible signal that nature gives us. We never stopped. During the pandemic, we had all this happening around us. The star is singing and the fans are in their own bubbles, and it is all happening. So we know how to discover things. We have discovered watered bottle. This was the way we used to have water from rivers earlier, and this is how we take water today, because this is the condition of rivers that we've done to our rivers. We also have created bottled air, and that too in different flavors. Yes, we have progressed a lot. The impacts of human actions on our home planet are now so large that many scientists are declaring it as a new phase of Earth's history. The old forces of nature that transformed Earth many millions of years ago, including meteorites and mega volcanoes, are joined by yet another, which is us, the humans. So the big question is, have we really entered a new geological epoch called the Anthropocene? Yes, the scientists agree. We are going to enter a very, very dangerous time. And as per Lewis and Maslin, globally, human activities move more soil, rock, and sediment each year than is transported by all other natural processes combined. The total amount of concrete produced by humans is enough to cover the entire Earth's surface with a layer of 2 millimeter thick. Microplastics are found in every ocean. We have cut down half of Earth's trees, losing 3 trillion, with extinctions becoming commonplace. Factories and farming remove as much nitrogen from the atmosphere as all of the Earth's natural processes. And the climate is changing fast because of the carbon dioxide emissions from fossil fuel use. Beyond these grim statistics, the critical existential question is, will today's extraordinary intelligence, acumen, and capacity that we have gathered over a long period of time, and which is unbelievably greater than any other time in our history, be able to save us from an almost sure collapse or not? Are we, as a community, progressing in the real sense? A careful analysis shows that each successive mode of living is reliant on a greater energy use, greater information and knowledge availability, resulting in an increase in the population and an increase in our collective agency at each step. But are we going to make the right choices as a community? Shall we at least now and quickly adopt to the eco approach? Are we going to remain anthropocentric as we are, or will we please bring down these curves by becoming ecocentric? We shall only be able to survive if we turn ecocentric and very fast take up measures to save the planet. So what are these measures? Believe me, these measures are simple but very profound, and they have to be taken at different levels. At ecosystem level, we have to surely go to regeneration and replenishment strategies. New strategies like eco-restoration, where the forest typologies are brought back, and rewilding, where the wild animals who have lost their house, they have to come back to their own forest, need to be taken up very, very fast. At an urban scale development, the ecological lens analysis and detailed EIAs to be carried out. Understand the genius loci of the site. What does the site's requirement is? Site and environment responsive development needs to be encouraged. Conserve and sustain, rather strengthen existing biodiversity of the sites. Pay back to nature in terms of replenishment of resources. Restore, recycle, reuse. At society and individual level, which I think is the most important, is involvement of communities to bring in the sense of belonging. Capacity building and outreach. Incorporate ecological studies at school and university curricula level. Optimize energy consumption and review individual lifestyle choices. Question even the general norms of living, including material aspirations and familial myths like hum do, hamare do. Really? So these are some examples where we as ecologists and landscape architects are looking very, very deeply into the ecosystems and how they can be brought back or revived. And these are some of the corridors that we have started to work on, where the animal and human conflict has been very seriously looked up and taken care of. In the last 3 to 4 decades, the disastrous and devastating impacts of environmental challenges have been realized, and the last 2 decades have witnessed the formation of various international and national level fora, including World Nature Organization, IUCN, UNEP, WWF, NGT, and so many of them that we know, to take charge of the grim situation by setting up principles of development further on. Other measures like SDGs and many other similar efforts at all levels and scales by the government, professional bodies, NGOs, research communities, scientists, citizen groups today indicate a paradigm shift, and the attitude of it is moving very slowly but constantly towards a more ecological and conservation-based relationship, seemingly I care, with the resources and natural systems at the center. Today, we need to pause and acknowledge the incredible power that modern society possesses. But more importantly and very, very urgently, direct it towards bringing up a positive shift, and with an eco approach as the central philosophy, ensuring that not only we manage to survive ourselves, but also attempt enough for an uninterrupted continuation of the most valuable journey called life. Thank you.
Thank you so much, ma'am. It was truly multidisciplinary in its approach, because you took us from the age of discovery to the age of Renaissance, and then we spoke about the landscape typology. You actually drew the bridge between the old world and the new world, and with this pictorial representation, I'm sure all of us have a very clear picture of the talk that you've just delivered. Thank you so much for such an insightful discussion about this topic, ma'am. Now, I'm sure we have a plethora of questions lined up for you. So I request all the participants to post their questions in the chat box, or they can raise their hand, and one by one we can take the questions. Do we have questions from the participants? I'm just, people are giving the feedback that it's an excellent talk. Dr. Sadhna ma'am has raised her hand. Dr. Sadhna ma'am, can you please unmute yourself?
Yes, I have unmuted my. Can you hear me?
Yes, ma'am.
Yes, good afternoon, everyone. Dr. Aditi, Aarti, very nice talk. So I just want to know, beside the government efforts, we have different laws which have been implemented to attain the sustainability. What else means you can say on the broader aspect, what can we do as a citizen to attain the sustainability? See, their laws have been laid down, government has laid down several policies, but it's very difficult to implement and to be adopted by the citizens. So can you please suggest something which can be done at the level of each individual?
Surely, that's from Dr. Gupta. Thank you, Dr. Gupta, for the question. And I think, as I mentioned in my talk somewhere, that there are certain things that need to be done at the ecology level. There are certain things which government can only handle, but there are a lot of things that we as individuals can actually take up. The simple thing, I think, to my best understanding, the simple thing that we can do is to reduce our own footprints. Like, I'll suggest each one of us to please do this exercise for ourselves sometime later and see from the morning when you get up in the bed and from the till the evening or late evening when you get back to the bed, how many instruments or how many gadgets did you use? How many messages did you send? Each message that you send is taking a lot of energy, and each phone or call that you make is actually hampering the life of birds somewhere. And there is a correlation of how these electromagnetic waves and these telephone waves, they are working in the environment. They are not working alone. They are working within the system. And that is the place where these animals and avifauna and we are coexisting at the moment. So can we reduce our footprint to the first thing that comes to my mind? Doing that would be more than enough, because I know that when the government suggests that, okay, let's get into some sort of a mode of travel where we use more of public transport. Most of us are not really comfortable. So maybe, yes, we have, but the counter question could be, do we have enough footpaths to walk? We don't have. So it's a dual system. The government is doing their bit, but as citizens, as a community of intelligent people who know that environment is the most important thing for all of us. Till the time the earth is, we are. When the earth won't be, we won't be. So let's try and reduce our footprint by reducing or maybe molding our requirements to less energy consuming items, the less energy consuming foods, less processed food. Let's go back to a little reductionist sort of an approach and find out if we can live in a low energy mode. That would be my answer to it. Brief.
Yes, correct. You are correct. But every time I used to think like, we are generating so much of solid waste, which is a problem. Solid waste management is a problem. And even today it was there in the paper that landfills in this near Ghazipur will take more than 197 years for the removal of that so-called mountain-like thing.
Yes.
So can't we do like we choose our local councillors? Can't we choose these local councillors to handle the solid waste management at the locality level? For example, in temples, we are generating flowers. We can collect them instead of throwing them into rivers.
You're right.
We can implant, we can put some machinery where we can generate from these our wastes from the home, which can be turned into manure. So I think efforts at these levels. Yes.
Actually, one point that you have just raised, urban local bodies, I think, have a major role to play in such activities in almost everything. Like I remember one of these incidents where the pandemic had just started and we were talking about how do we really reach to the grassroots? What do we do? Because we were all in a panic situation and we did not know. A government had given their own strategies. They had started to do things. But, you know, the best example, first model that was a success model was of Kerala, because all these urban local bodies were activated right at the beginning. And you remember what happened in Kerala and how we were lagging behind. And then very soon, of course, we all understood how to move forward. But their model was an eye-opener. and because of the involvement of urban local bodies. So you're rightly saying it, that yes, we need to look at all the levels of working.
Yes, thank you so much.
Aditi, you are on mute.
Sorry. Thank you so much, Sadhna ma'am. We can just take one more question since I think we have a paucity of time. So
Rana is there, right? Rana is there.
Rana ma'am, can you please, sir, ma'am, can you please unmute yourself?
I have a question that usually we talk about recycle and reuse, but when practically we don't do, because every house has lots of, garbage from house, kitchen garbage or anything. And what I noticed is when we cut the packet of a milk, the corner is not going to be recycled, the corner part of the packet, which is cut, and we just throw it. I usually practice it, but many few people practice it, that they put inside the packet which has been cut. So there should be an awareness program by the government, because Mangalore is already doing putting the different kinds of garbage in different bins, but in Delhi and other cities, metro city, I have not found any such kind of program. So basically the layman, the who is uneducated people, they should also be aware of all these kinds of programs, so that they should also start practicing. Then only it's going to be a better place for us to live in.
I completely agree. And there are other things which you just said is a very very profound statement to make, that corner of that milk
yeah, that is going to hamper the aquatic life, because if you don't put inside the bottle, what I do practically is I make a bottle, I put all the plastic, and at the end of the month, I put that bottle into the garbage. But not everyone is doing that. So if it is going to be practiced by everyone, it should be everyone should be aware of it. That's what my answer to your question.
True.
Thank you so. Thank you.
Thank you so much for your comment.
Thank you so much, Dr. Aarti, for being a part of our Equinox International Conference. We were really honored to have you with us for such a constructive discussion that we had, and all of us have some of the other thing to take away, like waste management and everything. Thank you so much, ma'am.
Thank you so much, Dr. Aditi. Thank you for having me. Thank you so much.
Yeah, it was very nice.
Thank you.
I would just request the participants to please join the session at 1:45. Especially the people who would be presenting their papers, please join at 1:45. And after that, once you join in there, we will tell you how to join the breakout rooms. You all have been assigned different sessions, like session 1, session 2. So the breakout rooms have been named as such, like you have breakout room 1, breakout room 2. So whichever session you belong to, where you have to present your paper, please join that breakout room. And in the meantime, please join at 1:45. And if you have any trouble, we are all there to help you out. Thank you so much.
Good evening, everyone. Our guest speaker, Professor Miguel, has just joined us. Good evening, sir.
Hi, good evening. How are you?
I'm good, sir. I'm welcoming you on the behalf of Maitrey College and Equinox 2022. And we're really looking forward for your talk. It's a very interesting topic. So I'm just going to start the session in a minute or two.
Thank you. Thank you very much for the invitation. It's a great pleasure.
Thank you, sir. Good evening, everyone. I'm Dr. Ghazala, and it's my pleasure to welcome you all to this session on the behalf of the organizing team, Equinox 2022, the annual international conference on the expanding frontiers of knowledge under the aegis of Vantage, the Journal of Thematic Analysis. Impossible is just the possible that someone has not put enough effort to make it come true. What is more inspiring than this quote by Professor Miguel Nicolelis? Allow me to introduce and welcome our esteemed guest speaker, Professor Miguel Nicolelis, MD, PhD, a distinguished Professor Emeritus, Neurobiology, Biomedical Engineering, Neurology, Neurosurgery, Psychology, and Neuroscience. Professor Nicolelis is the founder of Duke Center of Neuroengineering. He is the founder and scientific director of the Edmund and Lily Safra International Institute for Neuroscience of Natal. He is also the founder of the Walk Again Project, an international consortium of scientists and engineers dedicated to the development of an exoskeleton device to assist severely paralyzed patients in regaining full body mobility. Professor Nicolelis has dedicated his career investigating how the brains of freely behaving animals encode sensory and motor information. As a result of his studies, he was forced to propose and demonstrate that animals and human subjects can utilize their electrical brain activity to directly control neuroprosthetic devices via brain-machine interfaces, or BMI. Over the past 30 years, Professor Nicolelis pioneered and perfected the development of a new neurophysiological method known today as chronic multi-site, multi-electrode recordings. Using this approach in a variety of animal species, as well as in intraoperative procedures in human patients, he launched a new field of investigation which aims at measuring the concurrent activity and interactions of large populations of single neuron throughout the brain. Through his work, Professor Nicolelis has discovered a series of key physiological principles that govern the operation of mammalian brain circuits. Professor Nicolelis' pioneering BMI studies have become extremely influential since they offer potential new therapies for patients suffering from severe level of paralysis, Parkinson's disease, and epilepsy. Today, numerous neuroscience laboratories in US, Europe, Asia, and Latin America have incorporated Dr. Nicolelis' experimental paradigm to study a variety of mammalian neural systems. His research has influenced basic and applied research in computer science, robotics, and biomedical engineering. He is a member of French and Brazilian Academics of Science and has authored over 200 manuscripts, edited numerous books and special journal publications. He holds 3 US patents, is an author of books Beyond Boundaries, the New Neuroscience of Connecting Brains with Machines and How It Will Change Our Lives. The relativistic brain, how it works and why it cannot be simulated by a Turing machine. And the true creator of everything, how the human brain shaped the universe as we know it. Sir, it's a privilege to have you with us, and we will surely be enlightened by your extensive knowledge and expertise in the field of brain-machine interface. Over to you, sir.
Oh, thank you very much, Dr. Hari, for this introduction, this kind introduction. I truly appreciate it. It's a great honor, a great pleasure to join you on Equinox 2022 to give this talk. I'm just going to share my screen to make sure that everything works. If you could just confirm to me that you can see the first slide.
Yes, sir.
Oh, okay, wonderful. So in the next 30 minutes, then I'll give you a very quick overview of how, a basic neuroscientist like myself, I was trained to become just a neurophysiologist, first here in Brazil and then in the United States when I moved there in 89, found through the basic science approach a way to create a potential new paradigm for neurorehabilitation of patients suffering from very devastating neurological and more recently psychiatric disorders that until recently were deemed almost untreatable. First of all, just to make a summary, that's a slide that summarizes this journey of the past almost 4 decades, in which after developing methods to sample and analyze the activity of large populations of individual neurons in behaving animals, for more than 20 years, I studied cortical circuits and how dynamic and plastic they are. And it was this basic science work, I'll show a little bit of what I mean by that in the presentation, that I and my students derived a series of principles of neuroensemble physiology or physiology of populations of neurons that led us to propose that it would be possible to create real-time links between brains and machines. That's what we call brain-machine interfaces. That was done in 1999 with my great friend and former advisor, John Chapin. And together we proposed the brain-machine interfaces would provide not only further ways to study the dynamics of cortical circuits, the dynamics and plasticity of cortical circuits, which was the basis of our work, but it would also allow us to derive a more general theory of how the brain operates. And also, after a couple of years working on this paradigm, John and I realized that we would be able to design and implement a variety of new therapies for treating diseases like Parkinson's disease or conditions like spinal cord lesions. And that's what I'm going to show you today. Basically, this is the first image that we published to describe a brain-machine interface in 2000. And it shows how the concept operates. So you need a brain and you need to be sampling for whatever method, large-scale brain activity that can be processed in real time by using a series of computational and mathematical models that extract from the collective electrical activity of circuits that you're monitoring. You're going to see that this day we are able to monitor close to 2,000 neurons simultaneously, and this number is going to grow very quickly from now on. But if you can monitor this large-scale activity in real time and extract from it the motor commands generated by this brain to control its host body, we demonstrated that this can be translated into digital commands and rerouted to either mechanical, electronic, or even virtual devices that can now be operated. The movements of these devices can be created and operated directly by this brain, basically by establishing this two-way connection between the brain and these devices. Of course, we started many years ago using mechanical devices, but as I'm going to show you in a moment, this has evolved very quickly to include all sorts of machines, including virtual devices in immersive virtual environments that we use for our patients. One key component of this, of course, is that these devices, by providing visual, tactile, auditory feedback back to the brain, closes this control loop. And is that allows individuals, animals, or human beings to actually take advantage of brain-machine interfaces. And because we can control the kind of models that we use and the kind of devices that we implement to interact with brains, that makes this paradigm a very useful tool to approach very basic questions and a variety of theories on how the cortex and the human brain operates. So this is the rhesus monkey brain, just to show you a lateral view of the areas in which we implant electrodes when we did our experiments in primates. So these are homologous areas of the human brain, and that's the great advantage of the rhesus monkey brain, because it has pretty much all the cortical areas of interest in the frontal and parietal circuit that are important for the generation of voluntary motor commands that are used by brains to control body movements. And it was in this kind of brain that we tested and implemented over the last 28 years different types of electrodes, large scale recording cubes, we like to call them, to record the extracellular electrical activity of as many neurons, individual neurons, as possible. These are made of a variety of materials, stainless steel or tungsten or other metals that are covered with some plastics to allow just the tip of the electrode to record extracellular signals. And that's exactly what we use in our primate studies. And since 2014, the great breakthrough that happened in this paradigm was the possibility of having wireless transmission of large-scale extracellular brain signals, which liberated our animals to actually behave without any kind of tethering to equipment. So they can freely behave individually or even in groups. I don't have time to show this today, but we pioneer with this approach the ability to record multiple brains simultaneously while monkeys or rodents, but primarily monkeys, interact in social groups in a more ethologically normal environment. So that has generated data that are very, very interesting, because it opens the door for a new field independently of brain-machine interfaces that is called today social neuroscience, something that I'm very interested right now in my research. But coming back to brain-machine interfaces, this is just a bird's eye view of one of our implants, large-scale implants. You're looking from the top of an implant on the head of an adult monkey, and some of the primary motor and primary somatosensory areas implanted. And you can see here one of the largest recordings we ever did. These are individual neurons here on the y-axis. This is time. These are the waveforms identifying each one of these neurons. And we got to about 2,000 neurons recorded simultaneously from multiple cortical fields in a freely behaving animal that could be interacting with its peers in a social group. And that was a major breakthrough. But coming back to the original studies, this is how we actually demonstrated the concept, which many people doubted at the time, that you could establish these real-time links between brains and machines. And this is how we did it. This is an adult rhesus monkey that is using a joystick to play a very simple computer game in which a cursor has to be placed by moving the joystick inside of a moving target that appears randomly on the screen. So each time the monkey is capable of driving that cursor inside the target, it gets a drop of orange juice. And monkeys love that. And so by doing that, we get these monkeys to achieve a very high proficiency, above 95% correct of the task. And as the monkey was doing that, we were recording originally about 100 neurons simultaneously from multiple frontal and parietal cortical areas, as I showed you in the previous slide, the primary motor cortex, primary somatosensory cortex, posterior parietal cortical areas, or supplementary motor areas in the frontal lobe. And as we're doing that, we're basically transmitting these raw electrical extracellular signals to a variety of mathematical models that are running in parallel to extract motor information from this electrical brainstorm that could generate digital commands to basically control the movements of a robotic arm that was in a different room about 20 meters from the monkey, so that once the brain-machine interface was connected and the joystick was removed, the monkey could continue to play the same game I just described to you by virtually just imagining the kind of hand movements or arm movements that needed to be made. And now it would be the hand of a robot that would be controlling, under the control of the animal's mind, the movements of this cursor to intercept the target on the screen, allowing the brain-machine interface to operate and the monkey to continue to receive its reward. So this is one of the first monkeys that got that task right, this Aurora. You can see she's using a joystick. Oops, I'm sorry, my computer is too quick here. So Aurora is using a joystick with the left hand to basically intercept this white circle that shows up randomly on the screen. She's trying to guess, but she cannot play the game just by guessing because there are too many positions for this target for her to simply guess where it's going to happen, to show. But she's moving with the joystick, and every time she intercepts this target, she gets a juice reward. And as she's doing this task, you probably can still see these cables coming out of this head cap. Is because at that time we didn't have a wireless technology, so we had to transmit this with wires to a wall of amplifiers and computers that were processing these raw extracellular electrical signals from 100 neurons and transforming them through computational and mathematical models into digital commands that a robot could understand. Well, a few minutes after this, as you can see, she was doing pretty well, close to 100% correct. We removed the joystick. See, it's gone now. We turn on the brain-machine interface, and now every movement of the cursor that you're going to see is only happening because Aurora is imagining the kind of hand movements or arm movements she needs to make to intercept the target. This electrical activity coming from her cortex is being transferred in real time to these mathematical models, and the output of these models is driving the robot arm to now control the movements of this computer cursor, and is that movement that will intercept the target, not anymore any movement of the animal's body or the joystick. So this is how a brain-machine interface actually came to fruition. And for the first time, the activity of a monkey brain was liberated from the physical limits of the body of the animal to interact into the external world. So here we go. Now, every movement of this tiny cursor that you see is generated by the operation of the brain-machine interface by Aurora. In the beginning, she's a little reluctant because, of course, this is the first time she was getting this right after a few days of practice. But she eventually gets everything right. And you can see the same kind of trajectories that you saw before when she was using the joystick being generated so that she can actually acquire the target and receive the juice reward. But again, there is no body movement involved. She's actually imagining the patterns of movement in her head, and we are recording just a small, tiny fraction of the neurons involved in this operation in the frontal parietal circuit, but that was enough to generate these two-dimensional outputs. And in fact, we got to use a three-dimensional task with the same monkey, and she was able to do that. So this was the first classical demonstration that a brain-machine interface could be operated. And a year after that, we demonstrated the same kind of operation in 11 Parkinsonian patients during intraoperative recordings that were done to implant stimulating electrode through a procedure called deep brain stimulation. In 11 patients that were awake during the procedure, because that's how it happens, we were able to test the same computer programs, the same paradigm, and demonstrate that these patients were able to play virtually the same game that Aurora was playing here, but just on one dimension, and basically show that brain-machine interfaces could be operated by human subjects, as well as we had demonstrated in these experiments in monkeys. Well, things evolved very quickly over the years. And of course, a few years ago, we were able to implement, as I said, a wireless technology for about 300 channels, which allow us to record hundreds of single neurons, extracellular activity without cables. And that gave us the autonomy, and the animals also, to perform a variety of new experiments. In fact, this was the study by one of my Indian students, Shankari Hajangan, who basically was able to demonstrate for the first time that we could get animals to learn how to drive using a brain-machine interface and only cortical brain activity, how to drive an electronic wheelchair in our lab that was modified to be steered by the brain activity of these monkeys, so that the animals could navigate in rooms in our lab or in our hall, all the way to targets that we use to deposit grapes or fruits, so that the animal could basically, once it saw us depositing these grapes in a particular target, it could basically drive this car using only a brain-machine interface. If you want, this is the first self-driven car controlled by a brain-machine interface. And that gave us the last clear demonstration that this could be done in humans, in paralyzed humans, because these animals didn't need to move to control this wheelchair. They just need to think about the trajectories, and that allowed us to do that. So what I'm going to show you is a movie, first a camera on the ceiling of our lab, and then in the front, showing how the monkey that is placed in the beginning of each trial in a different position, 1 out of 3 positions in the back of a room, is able to drive this wheelchair to a target where it collects grapes as a reward. So here we go. The monkey, you're going to see from the top, you can see now the monkey driving the wheelchair, collecting grapes. Now we place him in a different location, and then he has to create de novo a trajectory just mentally, so that it can steer the 2 electrical motors of this wheelchair, so the chair can reach the target very quickly, so it can collect the grapes. So you see here the first demonstration of a large-scale wireless brain-machine interface for driving a wireless control or a brain control wheelchair. And the only movement that the monkey needs to make at the end is basically to collect the grapes and have this, what we joked in our lab was the first free lunch the rhesus monkeys could get, because they only need to think about it to actually acquire the reward. Well, that study was not only important to demonstrate a complete new application of brain-machine interfaces, but from a basic science point of view, it was very shocking to us, because when Shankari studied the properties of the single neurons in multiple cortical areas, like for instance in the primary motor cortex, the physiological properties of these neurons revealed a pattern that was very similar to the classical cell type that we know as play cells that were believed to be to exist only in the hippocampus. In fact, they were the reason a good friend of mine, Professor O'Keefe, and his students got the Nobel Prize in 2015 for discovering these place cells that encode extracellular, extrapersonal space. So this was discovered in rats originally. When rats were navigating in a maze, Dr. O'Keefe, back in the 70s, discovered that when you look at the tuning of these cells, and dark orange or yellow represents lots of firing, dark blue, no firing. you can see that if you're looking at the position of the monkey in the room, in the X and Y axis, some of these cells are firing only when the monkey goes into particular locations of that room. That's exactly what John O'Keefe has seen, and thousands of people have seen in the hippocampus of rats and monkeys and humans over the past 5-6 decades. But here it is, primary motor cortex, very in the classical view of the cortex, which I don't subscribe, by the way. The primary motor cortex is in the lowest level of this cortical hierarchy, and nonetheless, we can see place cells like we would see in the highest possible position in the hierarchy, which is occupied by the hippocampus. So this was a very shocking result, which I'm glad to report. 4 years after we reproduced or we published this paper, it has been reproduced by 2 independent groups in rodents and in monkeys. So we are very happy to see that this is now changing the concept, and that is space, extrapersonal space, is also encoded in a very distributed way in the cortex of primates. Well, once we saw the results that I just mentioned to you, original results with the brain-machine interface, John Chapin and I published this image in Scientific American in 2002, suggesting that patients with lesions of the spinal cord, severe lesions that render the patients paralyzed, would be able to take advantage of the fact that the brain continues to encode movements of the body, not exactly the same way, but it continues to function properly, that we could use a brain-machine interface to record these motor programs still occurring in the motor cortex, and then basically broadcast them through computer models to a new body, a robotic exoskeleton that these patients could wear. And by doing so, in 2002, we predicted that people would be able to walk again using this technology, coupled to a robotic suit that would basically be governed, be controlled by the raw brain activity of these patients that contain useful motor information. Well, it took us a decade, but in 2012, we created the project that led to that demonstration. That is called the Walk Again Project. It was an international nonprofit consortium involving people from 25 countries, more than 150 people involved overall. And the idea was to develop the first brain control exoskeleton. This was the original plan, a CAD/CAM image of what we wanted to do, to allow a human being that had been paralyzed for many years, close to a decade, due to a spinal cord lesion, to actually move again, walk again, under the control of exoskeleton that was basically operating under the control of the patient's own brain activity. And we chose to demonstrate that technology in one of the greatest events in the world, that is the opening ceremony of the FIFA Football World Cup that was going to take place in Brazil in June of 2014. So the project was created at the end of 2012, and in about a year, we assembled the entire international team that had neuro rehab personnel, neuroscientists, physicians, computer scientists, engineers, roboticists from all over the world, in order to basically achieve this goal. And this is how we did it. We, after several months, we were able to select 8 Brazilian paraplegic patients that had been paralyzed for periods no shorter than 5 years and longer than a decade in a few cases. And we start training these patients with the same kind of protocol that we use in our monkeys, with the exception of the fact that instead of implants in the brain, we use a non-invasive technology called electroencephalography to collect large-scale brain activity that could be used to control eventually an exoskeleton, a robotic exoskeleton for lower limbs. But before we got there, these patients had to be trained in an immersive virtual reality environment to basically use their brain activity to control an avatar of themselves, a virtual soccer player, football player, that had to be moved by the EEG, by the raw brain activity of these patients. And as you're going to see in a moment, as this soccer player, football player move on this pitch, in soccer fields, this all in virtual reality, we provided every time the patient, the avatar touched the ground, not only visual feedback, but also tactile feedback on the forearms of the patients to create a very realistic experience. And this was very important because not only allowed the patients to train how to use a brain-machine interface, but also reinstitute the concept of, for these patients, of having a whole body. Because once you have a spinal cord injury, your sense of self is limited to the level of the injury. So your brain eliminates the concept of you having a full body. For these patients to take advantage of our exoskeleton, we actually had to retrain their brains to believe that they really had a full body. And that was done with this virtual reality training. And after that was done, in about 3 months, we were able to move the patients all the way to intermediate steps until they were able to combine all these technologies to control the movements of a lower limb brain control exoskeleton. That's the first prototype. In fact, the prototype that was used during the opening ceremony of the 2014 World Cup here in Brazil on June 12, for a global audience, estimated global audience of 1.2 billion people, which was kind of mind-boggling, no pun intended, to all of us involved in this project. So let me show you how that worked. This is one of the main innovations of that exoskeleton. These are printed circuit boards that contain pressure and touch sensors that can be applied on the plantar surface of the exo's feet. So every time the foot or the feet of the exoskeleton touch the ground, a pressure wave is generated, and as you're going to see in a moment, is broadcast to a series of vibrating cell phone vibrating elements that are applied with Velcro to the skin surface of the patient's forearms. So the patient can actually sense when ground was encountered by the exo and basically receive this rich tactile feedback about the surface, the texture of the surface, and what is to be walking on the ground again. So look at this. This is one of these patients. This is in the immersed in the virtual reality football field that we created. Is controlling this football player, virtual football player that is going to be walking on the grass. And every time the foot of the virtual avatar player touches the ground, there is a pressure wave that is delivered to the forearm of the patient, so that in combination with the visual feedback, this multisensory feedback actually fools the brain of the patient to believe that he or she basically are walking on the field, not the avatar. And that's what they report to us verbally, that they felt that their own body was in that field, walking, even though they were, of course, paralyzed. So let me show you quickly this movie. So the patient is training in the immersive virtual reality environment. And what she's doing as she walks, when this avatar walks into the grass under the control of her brain activity, she's actually moving the hands on this space to actually find the best tactile feedback stimulating parameters, the strength of the vibration, the speed of the wave of signals crossing the forearm, so that she feels very well the texture of the surface the avatar is walking on. So this is now sand, like walking on a beach. She was walking grass a moment ago, and that's how we actually allow the patient to identify for herself or himself the best possible stimulating parameters for this experience, this tactile experience, to become extremely realistic. And they did find, for each one of them, they found the parameters that got them to believe that they were having a very realistic walk on the beach or on a football pitch. So for each patient, there was the first day in which all these technologies were put together. So this is The first day for this patient that had a very high thoracic level lesion, paralyzed for 6 years. He's now using a EEG-based brain-machine interface to actually walk with the exoskeleton. For the first time in 6 years, he's upright and about to walk. And every time he touches the ground, he's going to get this tactile feedback delivered to his forearms so that he experiences not only what is to walk by looking at a mirror that is positioned in front of him so he can see this experience pretty well, but he is going to feel the ground as he walks. So he's getting visual feedback that his brain activity is right. And now he's alternating left and right brain activity in the cortical hemispheres to actually create an alternating gait pattern. And he walks by himself. As he's walking, every time he touches the ground, he gets tactile feedback in the shape of a pressure wave that spreads on his forearm. So his brain is computing that visual and tactile feedback and literally creating a vivid experience that he's walking. And that's what these patients reported to us, that they were really feeling like their bodies were walking again, even though they were totally paralyzed, in this case, from the chest down. Basically, we discovered a way to induce the phantom limbs phenomenon. These patients were having classical phantom limb sensations by using this system, and that basically gave them the feeling that the entire body was moving again and sensing the world around them again. That was very important for them to get used to the exoskeleton and be able to practice every day, about an hour a day. For the World Cup, they had about 3 months of practice. And then one of the patients, Juliano Pinto, was selected to deliver the opening kickoff of the World Cup ceremony. Here is a few minutes before we went to the football field. We are in the ramp that takes from the locker rooms to the field. And Juliano asked me, he wanted to do a kick before he had to do it for real in front of 65,000 people in the stadium. And as I said, more than 1 billion people watching on the internet or on TV. Well, what you're going to see is one of my students, Suleiman Shakur, who is today a professor at the EPFL in Switzerland, puts the ball in front of Juliano. He tries to make his body look as erect as possible. And then you're going to see the lights of this exoskeleton, these LEDs blinking, meaning that the exo is on. And when you see green and yellow flow coming from the head to the legs, is because Juliano is starting the operation of the brain-machine interface, is imagining the kick in his head and waiting for the brain-machine interface to translate his thoughts into digital commands that made this exo allow him to deliver a kick. So Suleiman is going to place the ball. Now the exo is on and Juliano is ready to kick. And that's exactly what he does. And without Juliano knowing, when he was in the field, we turn on this pressure sensor on the toes that he has here that we never turn on during the practice. This was a surprise that we wanted to make to him. And when we actually turn it on and he kicked the ball, for the first time, he actually experienced the impact of kicking the ball that was transmitted to his forearm and then, of course, to his brain, where an image, a memory very likely was rekindled because as a Brazilian, since you're inside your mom, you're playing football. You're playing inside your mom with the placenta, but when you're born, they give you a ball even while you're still in the hospital and you start practicing. But Juliano, for 10 years, was in a wheelchair. He couldn't play football as he used to as a kid. And this was the sensation, the memory that we rekindled when he did the kick at the opening ceremony of the World Cup. Well, people thought that this was the end of the story, but it was not. A month later, all the patients returned to the lab because we are, as a mandatory requirement here in Brazil in a clinical trial, we had to do a neurological examination of these patients every 3 months. And until then, nothing different from what these guys have experienced for decades has showed up. They were paralyzed. They had no sensation below the level of the injury, original spinal cord injury. But a month after the World Cup, we were shocked. This is Juliano exam. And he was, as I said, originally a T4, a lesion at T4. He was paralyzed for 10 years below, couldn't feel anything in the body. But when we brought him back to the lab, we were shocked to see that now he had some sort of tactile sensation up to T11. He had recovered some sort of tactile feeling, 7 dermatomes below the level of the injury, something that we had never seen in our patients, and nobody had reported of this magnitude. The sensation was not normal, but it was pretty good and enough for him to feel when he was blindfolded and we touched different parts of his body below the level of his original spinal cord injury with a pin or with some instrument. So he could tell us, oh, you're touching my left side of my belly or right side. And as things went up, his sensation expanded even more. When we look in a second patient that day, we found the same phenomenon. That patient had increased the area of tactile sensitivity much farther down than the original level of the spinal cord injury. In fact, we kept tracking these patients for many months after the World Cup. And after 28 months since the training had started, the average recovery of tactile sensation or partial recovery was about 10 segments below the original level of the spinal cord injury. And that had never been reported before. This is the average for 7 patients that were followed for 28 months. When we saw that, we imagined, could we have something else in addition to this partial tactile sensation recovery? The patients were also reporting better control of their bladder, better control of their sphincters, better bowel movement control. So they were having also a visceral improvement. That's when we decided to start testing for motor behaviors. And to our total shock, 13 months after the training started, oops, see our movie here locked. Uh-oh. For some reason, let me stop sharing for a moment here, but my computer locked. I don't know if you can hear me. Can you still hear me?
Yes, sir. We can hear you.
Sir. Oh, I'm sorry. I don't know what is going on here. Never happened before, but my computer is totally locked. I can hear you, but I cannot move my slides. What I was about to show you is a pity, but for the first time after a decade, 14 years in being paralyzed, these patients moved again. They start producing movements of their body, their lower limbs, I'm sorry, something that they had never been able to produce after the spinal cord injury. So in addition to the tactile improvement, visceral improvement, what we witnessed was a partial motor recovery, something that the literature in spinal cord injury had never reported before, particularly because I was about to show you that these patients were able to move their legs, both legs. And in fact, 2 of these patients were able to regain a very high degree of walking mobility just by using a small cart, a walker, and a little bit of electrical stimulation of the surface of the legs. That was enough, given the amazing partial neurological recovery and the regaining of motor control of their legs that they acquired with this training. They were able to regain mobility if you provided them with some body support. And as a result, my last slide would be to show you that out of the 8 patients that started this trial as complete paraplegics, which is called Asia A classification, one of the patients had to drop out from the clinical study, but 7 remain in the study for 28 months. All 7 patients evolved to become partial paraplegics, meaning that they have moved from a complete paralysis and lack of sensations below the level of the spinal cord all the way to become partial paraplegics, which means that they had recovered a degree of mobility and that they could feel their bodies below the level of their injuries. And that was, again, unprecedented. So when we published our study in 2016, the first of a series of studies, the entire spinal cord injury community was shocked because we were showing something that people had never seen before in patients that were classified as complete paraplegics and had remained paralyzed for more than a decade. And that was when we realized that the idea that we had created as a basic scientist, the new approach known as brain-machine interfaces, had opened doors for the potential neurorehabilitation of millions of people that live around the world. About 20 million people live around the world today with the complications, long-term effects of a spinal cord injury. And I'm sorry for this issue. I never experienced anything quite like that. I guess the internet may have gone bad and the Zoom just locked for me here. But I hope that you got a feeling for what has been this journey and what is the potential of this technology for helping people regain mobility. Thank you very much.
Thank you, sir. I must say the talk was interesting, enriching, and it was inspiring. And because your talk just started from the superficial, the basic design of the brain and the brain interface, and how you have shown several interesting videos where the navigation of the monkey was carried out through BMI, and then later on it was applied for the humans also in the form of brain controlled exoskeleton study. So I'm just looking forward for the interactive session, sir. I hope the students and the faculty members are here. They would like to ask certain questions regarding So the participants are requested to raise their hand, or they can write their questions in the chat box.
Jyoti Jha wants to ask a question. Can somebody make her the co-host? Ghazala, till that time you can read the question in the chat box, maybe.
Yes. The question is from Gunjan. Robotic exoskeleton technology is helping paralyzed people walk again. Is this a reality, sir?
Have we lost connection?
I think so. We have lost connection.
Maybe he'll join again. Just hold on. Can you see him, Ghazala, in the participants list?
I can't see him.
No, he's not there. I think he has logged out, maybe due to some connection problem.
Of his talk was not visible. Actually, the screen was locked, and
Yes.
was also logged.
Yes.
But at least he was able to finish this very interesting talk.
Can you contact him over the mail or something, or WhatsApp or something?
Actually, ma'am, sir doesn't use a WhatsApp.
कोई phone या कुछ है?
नहीं, ma'am.
एक mail ही डाल दो quickly. You might just see.
Oh, hello? Hello?
Yes, sir, you're audible. We can hear you.
Oh, wonderful. Sorry, I got disconnected for some reason. And but it seems that things are working again here.
Yes, sir. Yes, sir.
Yes, sir. There are a lot of questions and people really want to interact with you. If I mean, you
Sure.
can just stay with us for some time.
No, I can. I just if you allow me for 2 seconds, could I just try to play the movie again, because was
Yeah,
you know,
sure. Sir.
because now probably I understand what happened. The internet went down here for a moment. Let's see if you could tell me if you can see it. Can you see it?
Yes,
sir, we can see.
Okay, now you can see our patient walking for the first time after 14 years. Okay, we never expected this. We just suspended her and asked her to see what she could do, and she did that. And a year later, the same patient, when we tried the same task, she was able to not only move the right leg, as you saw a moment ago, but she was able to do that. You see, it's the same patient, the cables are only recording muscle activity, and suddenly she was moving both legs. So she had an almost complete recovery of movements of both legs after 14 years of being a total paraplegic. And this is last slide. That's what I want to show. This is one of the patients that I told you recovers so well that with some little electrical stimulation of the legs and this cart and a little bit of body suspension, he actually could make gait movements by himself. He could walk by himself. Okay. It's slow, but after almost a decade in a wheelchair, there was a major change for this patient and all the others that were able to get this kind of level of recovery. So I'm sorry, I'm glad that I was able to recover this so I could show you the amazing results, and you could, trust to what I was saying just, okay? So I'm ready to answer the questions.
Yes, sir, there are a few questions.
Please.
Was there any difference between the coordination and the monitoring of the actions between the genders?
Well, we only had 2 women out of these 8 patients, 6 men and 2 women, so we could not address that question.
Okay. So another question is, robotic exoskeleton technology is helping paralyzed people walk again. Is it a reality now?
Well, it is a big reality because I didn't have time to show you, but we were able to move to the 3rd generation of this device. And now we have a very low cost system that is controlled just by an iPhone. All the electronics, all the interfacing with the brain is done by a regular smartphone. And that we are going to announce, hopefully as soon as we submit our publication, as a major technological breakthrough, because this first exo was very expensive, over-engineered, but now we have something that is very simple and can be used in a routine. in rehab centers, and we hope that as it keeps evolving, could be used even by the patients at their own houses.
One of the students, Soumya, she's asking how brain-machine interface is helping to communicate with human brain, and it takes how much time?
Well, brain-machine interfaces have been used now for patients that could not communicate anymore because they had lost the ability to speak, or to move. You know, these are lock-in patients. That's how we call them, due to a variety of the neurodegenerative disorders. ALS is the main one. They cannot move, so that helps them to communicate using their own brain activity, so they can write emails or interact with computers to produce voice, artificial sound, or artificial voices that allow them to communicate. That's in terms of allowing patients to regain communication skills. But you can also communicate with the brain directly by sending signals directly to the brain. We have done that. We have done that in monkeys. Unfortunately, I didn't have time to show you this experiment, but it's called a brain-machine-brain interface. And we use electrical signals to deliver the signals in monkeys directly into the somatosensory cortex to provide tactile feedback directly to the brain. There are other ways to do that with transcranial magnetic stimulation in humans. Is a non-invasive way to communicate back to the brain, which has been developed, and there are many applications now showing up.
That's really interesting, sir. Another question from a student, Naisha. She's saying, it's great to hear that robotic exoskeleton has helped so many patients move, but can it be commercialized for common people? It is also my curiosity, sir, how this technology will be available for a common people. Actually, it is a sense of hope for those patients, paralyzed patients.
Yes. We now that we have this prototype that has been tested in a much larger clinical trial, we are very confident that this could become commercialized, and we are talking to potential partners to do that. So it's going to come and it's going to be affordable. That's what is one of the main reasons when we start this development. At that time, we are talking to the Brazilian National Health Insurance Program, which is a public program, is a free program, to see whether the Brazilian government could help us once we have this prototype, low-cost prototype, to distribute this for free for patients in Brazil that had spinal cord injury. So, of course, things have changed a lot in Brazil in the last 6 years, but we are hoping that eventually this could be one of the venues, at least here, down here, to allow patients to have access. But yes, we are now with a project that is pretty much tested clinically, that can be commercialized, and we are hoping that in the next couple of years that would become reality in the United States and Europe, and hopefully in Asia.
Okay, thank you, sir. One very interesting question is there. The student talks about the neurotechnology, and she's asking whether this technology is applicable for the birds which cannot fly.
Birds?
Yes, sir.
Oh, that's a good one. I never thought about that. I never thought that we could get birds to fly again using a brain-machine interface. I'll keep that in mind. But no, I have never thought. I never seen an experiment about that at all.
Another question, another student just wanted to ask, sir, as we know, the brain of monkey and human are very much similar, as both are primates, but the frequency of sending electrical signal by brain of rhesus monkey is also same. And sir, one more question is, brain interface machine can work in all animals in the same way?
Yes, in the first question, the answer is yes. It's very similar. Both the recording and the processing of data that you see that we did in monkeys was identical. But you have to realize that if you go from an intracranial recording to a surface of the scalp recording, then things change. But the same method applied to primates can be applied to humans. We have tested brain-machine interfaces in rodents. different types of rodents and different types of primates, and of course in humans. But I assume that you could get other animals, or some people have tried in pigs, although pigs are not very smart for the kind of operation that we need to do, behavior tasks that we need to do. But I assume that you could do it in pretty much any mammal. Dog, I don't. Yeah, I don't see a major limitation. The only problem is you have to be very skillful to train the animals to perform the behavior task.
There's one very interesting question, sir. How these brain-machine interfaces work while dreaming or at subconscious level or while just thinking?
Well, the main application that I have shown you requires the patient or the animal to be awake. So it is basically about thinking. I think they'll be very curious to try, and we try in monkeys when they were sleeping, and we saw some interesting things because, of course, all primates, all mammals dream about moving their bodies. So we were able to get some, we never published this, but we saw when the monkeys were taking a nap that they were probably dreaming about moving their bodies because we could extract motor information from the motor cortex that was very similar to what they were doing when they were awake. So this is anecdotal because it was only one monkey, but I remember that we were very surprised. Although we shouldn't be very surprised because we know the animals dream about moving. It's well known, like us.
So one more question is there. Motor skills are performed unconscious and automatically following an initial period of conscious attention and learning. What is the condition that were used for those who were severely paralyzed?
Well, that also happened in these paralyzed patients. In the beginning, it was much more difficult because they had to be very focused. They have to pay attention very carefully on the task. And they actually reported to us that an hour a day of intense focus and intense control of the exo and the virtual reality environment, they actually felt tired. But as they got better and better in this task, they actually reported to us that they needed less and less effort. So it was becoming automatic for sure. So we saw a little bit of that transition, but in the beginning, the patients have to focus a lot, even because the EEG signal is not as informative as if you're recording in animals inside the brain. So they had to actually develop a way to concentrate and to get things done through a very high level of attention in the beginning.
Thank you so much, sir, for answering all the questions of the curious minds of our college. And thanks for being with us.
Well, thank you very much. I appreciated the opportunity and the invitation, and I wish you all the well in the meeting. And thanks for this kind invitation. It was a great honor for me.
Thank you, sir. There is a small ritual. I request every participant to switch on their cameras for the group photograph.
Participants, you can switch on your cameras so that we can have a group photograph together.
Thank you so much. Thank you, everyone, being there for this session and listening to Professor Miguel.
Thank you very much. A beautiful session. Fantastic.
Thank you. Thank you all.
Thank you very much.
Thank you for joining us so early in the morning. Because of the time difference, I was constantly bothering Susan also.
No bothering. It was a pleasure. Thank you. Sorry for the computer problem here, but I was happy that I was able to reset and show you the final movies.
Thank you. Thanks.
Thank you. Have a good meeting then. Thank you.
Yeah.
Bye-bye.
Bye.
Bye-bye. Thank you, sir.
Thank you.
The participants are requested to fill the feedback form. The link is present in the chat box. Please fill the feedback form.
Well conducted, Ghazala. Congratulations.
Thank you, ma'am.
Yes, it was a very nice session.
Very
and
nice session.
Very nice session.
I was really happy that he could actually join us. Till the last moment, I was so apprehensive that maybe because of the time difference or something.
No, but I'm glad he came. It was a very good. उनको भी बोलो ना लिखने के लिए कुछ.
Gopi ma'am, I've watched so many videos of Professor Miguel, and basically the FIFA World Cup 2014 वाला video. कितनी सारी चीजें मैंने पढ़ी. Then Broditi ma'am told कि I'm still thinking whether he will join or not. I was like, okay.
मेरे को दिख रहा था कि तुम काफी homework करके आई थी. बहुत अच्छा.
No, actually, Gopi ma'am, even for the first time, मतलब मैंने भी इनका TED talk में I had heard him, and मतलब तब से I don't know how everybody just everything fell into place.
Yeah, of course, and we have had amazing sessions, and I think it has been beautiful till now. And unko bhi bolo he should contribute to us for Vantage.
Yes, actually, he is very irregular with his mails. That is why previously also, I mean, after 1 month, he used to respond. That is why I was very apprehensive. So
That's very nice, very good. I mean, I was quite sure, but commitment they देंगे तो these are great people. I mean, they will never back out.
Yes, ma'am.
Great work, fantastic.
Thank you, Mamta. Mamta is writing that you bring Pearl speakers for us.
You bring what speakers?
Yes, ma'am. Very much informative. बहुत ही अच्छा लगा. 2 दिन से सुन रहे हैं. बहुत ही अच्छा लग रहा है. आज के सारे सेशन बहुत अच्छे थे.
तुमने ज्वाइन किया उसके लिए हम बहुत खुश हैं, आभारी हैं.
हाँ, बिल्कुल बिल्कुल.
अरे मैम, मेरा प्रेजेंटेशन भी था एक्चुअली.
Excuse me, ma'am. हाँ, प्रेजेंटेशन भी था.
Thank you so much, ma'am. Thank you so much, organizers.
It was
Thank you.
pleasure. Very nice. हम सबका ही प्रोग्राम है भाई. So it's great.
So second day
successfully completed 2 days.
Completed, yes.
Varsha, you joined. It was so nice to see you being here. Such a pleasure.
बहुत अच्छा रहा 2 दिन. This was very good. बहुत अच्छे सेशन रहे सारे.
बहुत अच्छा. आप join किए. It made it further successful. All of you. It's really nice.
Your hard work paid off.
Sorry?
Your hard work paid off.